The Senate will come to order. Senator Wiklund.
Thank you, Mr. President. I impose a call of the Senate.
The Senate is now under call. Senator Friends.
Thank you, Mr. President. I move that further proceedings under the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Members remaining under motions of resolutions will revert to the third order of business. Messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file as amended by the House, in which amendments the concurrence of the Senate is respectfully requested. Senate File Number 334, a bill for an act relating to education, modifying professional development requirements for READ Act implementation. Senate File Number 334 is herewith returned to the Senate. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
I'll call now on Senator Wiklund for a motion.
Thank you, Mr. President. I move that the Senate concur in the amendments by the House to Senate File Number 334 and that the bill be placed on its repassage as amended.
Senator Wiklund, would you be so kind as to explain the changes made by the House to Senate File Number 334?
Thank you, Mr. President. Yes, this now is the session IT modernization package. This bill now contains provisions that relate to short-term funding for IT modernization projects. It contains language relating to collaboration between agencies and counties and a structure to have that work go on. And it contains also legislative commission on human services systems, as well as funding appropriations for many of the governor's proposals that relate to systems modernization. It also introduces a modernization fund, and that will become a mechanism for adding funding to it to promote a long-term modernization approach for IT funding. And I can go into more detail, or we can move to the first motion. Or
well, let's see if there's any discussion or questions before we vote on the motion. Seeing none, all those in favor of Senator Wiklund's motion to concur with the House to Senate File Number 334, say aye. All those opposed say no. The motion prevails. Anything else? We should give the bill its third reading.
Senate File Number 334, a bill for an act relating to state government, creating a Human Services Systems Modernization Advisory Council and a Legislative Commission on Human Services Systems.
Third reading. Senator Westrom.
Mr. President, would the author of the bill answer a question?
Senator Wiklund, will you yield for a question? Yes, Senator Westrom, the floor is yours.
Mr. President, Senator, can you give us a little more detail on how this is going to ensure technology updates happen that work with the county social services office and is not a top-down approach and will in fact take feedback, and our counties will have meaningful input and power to have outcomes that they want and that they are a part of, as opposed to a top-down approach. Because we have a history recently of MNLARs, MNsure, websites, and technology revamps that have a disastrous outcome and have been a frustrating change for the counties or the people that implement them or try to use them. And so I guess I would just like you to respond to that before we make a final decision on this.
Senator Wiklund to Senator Westrom's question.
Thank you, Mr. President. Yes, happy to talk about that. The things that I really appreciate about this bill are that it's not just addressing funding, because we know that resources are important to be able to address these IT projects that we have heard from our counties are essential to move forward with. But the bill also puts in place a structure to actually formalize how counties and the agencies that impact them when they are making determinations about projects, Minute, DCYF, and DHS, it puts in place a structure that is called the Human Services Systems Modernization Advisory Council. And this advisory council is made up of, the members are from the agencies, Minute, Department of Children, Youth, and Families, and Human Services. And then there are 2 members that are appointed by the Association of Minnesota Counties and 2 representatives of County Financial Assistance Administration appointed by MAXA, the Minnesota Association of County Social Service Administrators. And then there's also 1 representative that is from federally recognized Indian tribes located in Minnesota. And so those members of the council will work together. Their duties are to provide recommendations to the commissioners on prioritizing governance, financing, development, implementation, integration, replacement, and modernization of current and future human services systems. And then it lays out a number of tasks that they can perform. It's not limited to these, but it lays out some things like reviewing the status of legacy and replacement human services systems, advising on statewide modernization priorities, so that it lays out tasks for them to perform. This group is designed to meet at least quarterly, and there will be recommendations that come out of this council. There is a clause, subdivision 6 in section 2, that requires prior consultation with this group to have the agencies bring forward major modernization projects, and if they would materially affect counties or the federally recognized Indian tribes, they need to come forward and bring that concept to this council for review, and then there can be discussion and recommendations put forward from that. So that is one way that I think this will strengthen processes that really aren't in place in a formal way. And I believe that will go a long way to strengthening our approach for IT development.
Senator Rustrom.
Thank you, Mr. President. Thank you, Senator Wiklund. If she would yield for one more question, Mr. President.
Senator Wiklund will yield for another question. She will. Senator Westrom.
So, Mr. President, Senator Wiklund, under Clause 6, upon review and your recap, does the group have any final authority, or is it just that they have to consult, or can they actually, if they don't like it and not respond favorably, do they have to go back to the drawing board, or can the agency still just move ahead without their consensus?
Senator Wiklund, to the question.
Mr. President, Senator, they do have the ability to, if they do not adopt a recommendation of the council, the commissioners must provide, well, that's if a recommendation comes out of the council. If they bring something forward that the council does not agree with, it doesn't completely stop the project from going forward. But what our hope is that this group, by working together and by being made up of county membership and agency membership, that they will develop a process that does influence prioritization and development work, and that the projects that move forward are the ones that are meaningful for counties as well as the agencies.
Senator Westrom.
So, Mr. President, thank you, Senator Wiklund, for your explanation. That's helpful. I'd like to listen to more discussion on this, but the reason I asked the questions, Senator, to the author, Senator Wiklund, and members, we want to make sure if we're going forward with significant technology improvements that our social service directors and counties have talked to us a long time about, and if it's really a significant bullet in updating their systems to avoid fraud or help catch fraud early on in the system, which is what my directors have talked to me about. I don't want to take a kick at the football and have a Charlie Brown effect that we kicked at it, we missed, but we thought we were doing something good, and it didn't turn out that way. And so that's why I raise this questions, because a top-down will not likely work in these situations where you have experts and directors at the county level, and when you can cross my 6 counties and my Senate district, and it seems unanimous from the directors how important this is, and you extend that out to the state, and it seems like it is every corner of the state, the county directors and those involved with this program are adamant, but have a lot of input to offer and skill. And so just being skeptical of how MNLARS and how MNsure in our recent history have kicked the football, and we, the legislature, metaphorically speaking, have landed on our butts and then had to spend millions, tens of millions or more in fixing stuff that they got wrong, the departments and agencies, because it was we go ahead, we know what's right, and we didn't take the input of the local people that execute this for the customers. And so we found that out afterwards. And so I don't want to find this out afterwards. I want it to be started and done sooner than this bill will probably bring it. But that's because I want to get this system fixed and stop the fraud here in Minnesota. And if this is a meaningful tool to do it, let's get going. One last question, Mr. President, if Senator Wiklund would yield.
Senator Wiklund, will you yield for one last question? She will yield. Senator Westrom.
Mr. President, Senator Wiklund, the funding mechanism, if you could just explain that to us a little bit more. As I understand it, some of the future surpluses will be dedicated up to $50 million to replenish into the account to continue this technology. If you could explain that, but then also there doesn't seem to be a cap or a sunset, and so this money could go into perpetuity. And so a program that my directors have largely told me about $150 million is what the estimate is to fix. 10 years from now, we could have $500 million in this account and spent on something that should maybe only cost us $150 or $200 million top end. How do we stop this money from just continuing to go out if we don't have a sunset or cap? If you could answer those two parts of the question. How it's funded, and any sort of cap or end date that we have that doesn't appear to be in this bill.
Senator Wiklund to the question.
Thank you, Mr. President. The transfer mechanism, as you mentioned, it is a way to have an automatic transfer of some surplus funding, depending on what is occurring in a biennium. There can be some surplus money that would go into this account, the modernization account, but that is capped. The transfers are capped if the account reaches $50 million. So after that, it would not be automatically, transferring any additional funding from the reserve or from excess resources. If the legislature decided that a project did require more than $50 million, then obviously the legislature would have to put additional money into this account to draw on for projects. But it will not, continue to grow excessively beyond the $50 million due to this mechanism. Also, that fund is designed to have a lot of definition about how the money should be used. It does state in the bill that Minute needs to provide a long-term modernization roadmap so that people are working together to come up with what the best long-term plan is. As you mentioned, some system replacements would be very costly, and it could be, tens or $100 million or something. But this long-term plan would help us identify, like, what is the best way to move forward? Is it replacement, or is it updating or modernizing existing systems? And it is designed to require the input of the counties and federally recognized Indian tribes along the way to make sure that what is advanced is something that everybody is getting behind. I hope that answers your question, but let me know.
Senator Westrom.
Mr. President, thank you, Senator Wiklund. It does answer my question. It does still give me some pause or concern that we don't have some sort of sunset or timeline or max amount that's been transferred to this account, because if the 50 million is empty and the surplus, the next surplus forecast comes around, how I'm understanding this is that money would be replenished up to $50 million a year. And so, call me skeptical, but government agencies and consultants seem to always find a way to bleed the money hard when they know there's money there. And I just think and wish maybe we had a little more oversight or a sunset of, say, 4 or 5 years, 3 years, so we bring this back to the legislature, or a cap of a max of 200 million or 250, some number, so we don't, once we pass this, elections happen, this body will be different next year. Many members won't even remember or know this debate, and so there should be a system that brings it back or forces it back to us without just being on autopilot or funding into perpetuity. And so I just raise that concern. I realize we're balancing all of these things, but that seems like a sunset or a cap would have been an easy thing to slip into this just for good governance, and forcing it back for legislative review in a 3 or 4 year period without just having it unending potentially or theoretically, and that's what the language does. So I'll let other people discuss it, Mr. President. Those are some of my concerns on both sides of the issue.
Senator Holmstrom.
Thank you, Mr. President. This bill comes forward after a long time of 15 years of Democrat-controlled administrations failing to tackle this problem. Money keeps getting appropriated, and the problem keeps getting not solved. I know we all, in our last few days here, like to pat ourselves on the back and pretend like we're doing a good job. But this bill misses the mark for me. This bill is not, it's offering unlimited amounts of money with no sunset in sight. And we're going to vote for this bill, and we're going to pass this bill today because we have no other option. These systems are so degraded, these systems are so old, and so incapable of doing the job that Minnesotans need them to do that we have to do something. And it seems like we just keep doing something. We never do the right thing here. We just try to do something. And man, it is frustrating. It is very frustrating to vote to bring this bill forward, to pass it, and to give this money to the administration, who is sure to try to find ways to waste it, as they have done for the past 15 years, as they have done for the last 30 years. And I appreciate that there's plenty of legislative oversight. There's a lot of hand-holding, a lot of micromanaging from the legislature, not something that we should have to do, but unfortunately we're in this position. But I think we need to aim to do better here, guys. I know we're only here for a few months, and we like to really push things up to the deadlines that legislators don't have a chance to amend or to fix these bills or get their opinions heard on these bills. And that's fine. We can play those games, but the people of Minnesota are who really suffer.
Senator Coran.
Thank you, Mr. President. rise in support of the bill that Senator Wiklund put together, and thank her for the work that we've been able to do together, especially around modernization. We've all heard, everybody's talked about the years and the decades. Every single person in a county or a tribe that's managing the actual work that's done and with the tools they've been stuck with. I'm not a huge fan of advisory councils and commissions or task forces, but this one, or these ones, I think are going to be a good foundation to do the discovery, and it's going to require the legislative oversight because of the very activities that didn't happen over the last 15 years to really drive this project forward. There's short-term needs, and we're going to have to fill those to the advisory council and the commission promptly, and I think any of those that are going to be here that aren't a part of the Quitters Caucus for next year, that it's going to be a very active role, and we're going to need to make sure and drive the functional activities to have a plan to not only address short-term needs, we're going to have some real creative thinking and ad hoc to meet the demands, to meet eligibility, the new eligibility determination requirements for SNAP, and all of those sorts of things are part of the short-term, and then mid-term would look into painting that picture of laying out some timeframes, activities to ensure we bring forth through the procurement process and the research, and we're going to have to drive it, which we normally wouldn't do as a legislature, to start to prepare us to move into procurement and to be able to articulate what that system, systems looks like. In the meantime, we are also going to have to guarantee that the counties and the tribes and those that actually serve those in need and the providers who take care of those in need have an equal place at the decision table. We cannot move forward with another application development or major systems modernization without them having an equal seat at the table in the decisioning through every single step of the way. If we do that, I think we'll finally be on a pathway to solving the short-term, mid-term, and long-term needs. So, Mr. President, I do, and Senator Wiklund, I thank you for the work that we put on it. It's a great foundation, and it's going to be us who are not part of the Quitters Caucus to make sure to bring this thing home. So thank you, Mr. President. Thank you, Senator Wiklund.
Senator Lucero. Thank you, Senator Lucero. Any other discussions before we go for final passage on Senate File number 334? Final comments? Any final comments, Senator Wiklund?
Thank you. I'll just make comments about a couple things. One, I just wanted to reiterate that I'm supporting this bill and very happy about seeing it move forward because it does allocate really critical funding this year to get going on projects that are absolutely essential for helping the counties. And one feature of the bill is that one of the appropriations of $10 million is designed to be given to counties by application process to actually do some of this IT development work that they have been doing, to give them some resources to continue that work. And that is something that I've worked closely with AMC and MAXA over this past it's been about 6 months now. The counties have come forward with a very refined list of projects that they would like to continue to work on, but they don't have access to resources. So that is one thing that is unique about this bill, and I think that it's essential that that we get these resources to the counties. Another, I would just like to point out, Senator Westrom, if you're here in the next term, I think you should look into the Legislative Commission on Human Services Systems, because that group of legislators is going to be responsible for providing legislative oversight, monitoring, recommendations regarding the planning, financing, procurement, development, implementation, operation, and modernization of human services systems. And I think since it is such an important area, both from the standpoint of being financially impactful to the state, and it affects many of our residents who interact with these systems. So I hope that there will be legislators who do get on this commission and then really start to learn more and provide more feedback on how these systems modernization projects move forward. And I just, again, would like to thank the counties for their work with me this session, trying to come up with targeted language, and this has been a really collaborative effort, and I hope that collaboration will continue now if we get these bodies set up, the Advisory Council and the Commission, and I hope that you all can support the bill. Thank you.
The Secretary will take the roll for final passage as amended to Senate File Number 334. Members, please vote. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Fateh votes aye.
Senator Fateh votes aye.
And Senator Murphy votes aye.
Senator Murphy votes aye. All members having voted who desire to vote, the Secretary will close the roll. There have been 67 ayes and 0 nays. The bill is passed and its title agreed to. Members, we are still remaining under motions and resolutions. We will revert to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file, as amended by the House, in which amendments the concurrence of the Senate is respectfully requested. Senate File Number 4401, a bill for an act relating to cannabis. Senate File Number 4401 is herewith returned to the Senate. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
All right, we're going to Senator Dibble for a motion.
Thank you, Mr. President. I move that the Senate concur in the amendments by the House to Senate File Number 4401, and that the bill be placed on its repassage as amended.
To that motion, please explain the changes made by the House, Senator Dibble.
Thank you, Mr. President. Members, as you recall, Senate File 4401 is a almost 100-page bill that we passed over to the House. It remains largely the same bill as we passed, with a few changes, some additions, and some modifications. Very quickly, Mr. President, they included a provision that had been originally championed by Senator Port that clarifies that medical consultants and pharmacists can be employees or contractors at micro retailers, meso retailers, and the retail license holders. The macro businesses would remain employees of those businesses. There is a provision that allows businesses to transport product to testing facilities for 30 months. That would allow, of course, some time for more of those who are transport-only licensed to come online. There are protections within that provision to provide against tampering and other problems. It's very, very important that we get those products to the testing facilities so that then they can be made available to the public for sale and consumption. There is a change to the true party of interest provisions that allow those true parties of interest to operate municipal facilities, municipal retail outlets, without being held to the existing what we call TPOI provisions that are in the cannabis chapter. So that allows, of course, more folks to come into the space and operate those facilities on behalf of our munis. There is a change for those businesses that are looking for equity investors, more investment income, the smaller businesses that are trying to raise capital so that they can get stood up and start moving on the licenses that they've applied for. So a true party of interest can now own up to 33% of up to 4 social equity businesses. That's a big change for those small businesses trying to raise capital and is very, very helpful. There's a preliminary applicant extension window which requires a 6-month extension and a discretionary another 6-month extension for good faith efforts to extend those preliminarily approved applicants so that they have time to secure capital or other infrastructure before that preliminary status expires. There is a clarification that combined cannabinoids allow up to 400 milligrams in drinks that are less than 1,000 milligram of each cannabinoid or those that are combined. These are actually limits that are set in law, but this is a provision that clears that up to address some industry confusion. On the psilocybin federal funding request that we passed out, we also add to that direction to the Office of Cannabis Management, OCM, to report back on what it might take to stand up a psilocybin pilot program that would be responsive to the recommendations of the 2025 Minnesota Psychedelic Medicine Task Force's legislative report. On streamlining, we do have the canopy set at 45,000 square feet. That would be on a graduated basis, starting from 38,000 square feet, working their way up to 45,000 square feet. The number of macro licenses would be capped at 8. Those mezzo businesses that would like to be reclassified and move up to a macro size business, those reclassifications will be based on market need, would require that they have 2 years of the medical endorsement and allows for that reclassification to occur once every 12 months. There is a provision that defines what a high-need medical product is and a requirement that they be carried within 24 hours or be made available within 24 hours of a cannabis patient attempting to purchase one of those high-need medical products at a micro-size business, a meso-size business, and the retailers that are connected to the macro would have those high-need substances in stock. So members, this is what we were talking about the other day, the oils and tinctures, et cetera, that have been problematic in terms of proximity and affordability, et cetera, particularly the non-intoxicating cannabinoid oils that are important for young people, children with seizure disorders. And then, as we had discussed earlier, establishes the outdoor growing limitation as 1 acre. That's comparable to about, I think, 47,000 square feet of canopy and requires those to be either indoor or outdoor at those companies, not both. Those are the changes, Mr. President, and I'm happy to respond to questions. Thank you.
Any other discussion? We're on the Dibble motion for Senate File Number 4401. Senator Holmstrom?
Thank you, Mr. President. I'm wondering if the author might yield for a question.
Senator Dibble, will you yield? He will yield. Senator Holmstrom.
Thank you, Mr. President. I am wondering what the canopy limit was agreed upon. I don't know if he said it. I might have missed it.
Senator Dibble to the question.
Thank you, Mr. President. Also, I'd like to request a roll call vote on this motion before I forget.
Roll call requested. Roll call granted. Senator Dibble.
Thank you, Mr. President. I will assume that Senator Holmstrom is asking about what would be previously or currently known as the Med Combo license, now just becomes the macro license. It will be ultimately 45,000 square feet on a graduated basis, starting at 38,000 in year 1, moving to 40,000, then to 42,000, ultimately landing at 45,000 square feet.
Senator Holmstrom.
Thank you, Mr. President. And one thing I don't know if we ever got publicly, nothing came to our desk here, but I'm wondering what the position was of the Minnesota tribes, if you have heard that.
Senator Holmstrom, you're looking this way, and are you asking him to yield?
I am asking him to yield.
Senator Dibble, will you yield? He will. Will you yield? Senator Dibble.
Thank you, Mr. President. If I understand Senator Holmstrom's question on this proposal, I don't know. That has not been communicated to me.
Senator Holmstrom.
Thank you, Mr. President. I just always want to keep that in mind with our votes moving forward. Thank you.
Senator Lucero.
Thank you, Mr. President. Would Senator Dibble yield for a question?
Senator Dibble, will you yield? He will yield. Senator Lucero.
Thank you, Mr. President. Senator Dibble, I just heard the exchange between yourself and Senator Holmstrom's answer that it'll start at $38,000 with a graduated increase up to $45,000. I'm sure you recall the conversation we had that Vireo purchased the Great River Energy facility in Elk River with the assumption that they would be able to be permitted by law the 90,000 square foot canopy. I expressed those concerns when we were debating this bill on the Senate floor. Now it comes back from conference committee, starting out even lower, down to 38. Do you have any advice for the job offers, for the employees, for all the people that are going to be impacted because of the result of the language of dramatically cutting the maximum canopy? Do you have any advice for these people?
Senator Dibble, to the question.
Thank you, Mr. President. I'm not quite sure how to respond to the question exactly, but I will just reiterate what I've expressed a few days ago, and that is that with streamlining, the previous construction of streamlining was a combined canopy that presumed a separation of medical and adult use. And as the conversation ensued at the direction of the Minnesota legislature beginning last year, to which all parties were invited, there was a recognition that the ability to collapse the grow operation under those canopies, to combine both adult use and cannabis and medicinal created a great deal of greater efficiency. The idea was not to simply allow for a particular one or two companies to get special consideration in a manner that they would overwhelm the marketplace, which would, of course, happen with the change that is happening under streamlining. Streamlining means that all of that product can be grown in the same space, and the company can decide what to do with it after cultivation and on its way to either manufacturing or wholesaling or retailing. Thank you, Mr. President.
Senator Lucero.
Thank you, Mr. President. I cannot express enough how disappointed I am. A lot of words, but no answer there. You know what's collapsing, Mr. President? The businesses in this state. You know what's collapsing? The good-paying jobs in this state. We just saw another example this weekend. For those who saw the headlines, St. Paul, another of the commercial buildings just sold for 1/10 its previous sale in 2015. Do you know why it's collapsing? Because of garbage like this. Businesses are trying to do the right things. They're trying to read the law. They're trying to follow the rules. They make decisions on increasing capacity. They make decisions to increase their workforce. And then the legislature cuts them off at the knees, changing the law when they are mere weeks from starting operations. I offered an amendment on this floor that would at least grandfather in the scenario I'm describing. Scenarios of operations that are a work in progress about to open. There was no interest to even grandfather that situation in. Mr. President, here's my advice for the job creators, for the businesses that are in Minnesota now, and for those businesses that are even potentially considering coming to Minnesota. Don't. Job owners, if you're here, or job creators, if you're here now and you have an opportunity to relocate, get out. This state is collapsing because of policies that are being pushed by the Democrat majority. And this is the clearest example. Get out while you still can. There are other states that have much better business climates and allow you to offer those great paying jobs, to expand, and to help the local economies. And they won't be in areas like Minnesota that make it harder or impossible to do the great work offering products and services that you're trying to do. Mr. President, what a sad, sorry bill. Vote no.
Senator Port.
Mr. President, I'll wait till third reading.
Any other discussion before we give the bill its third reading? Oh, the motion first, I'm sorry. Before the motion, all those in favor of adopting, roll call was requested, roll call granted. The secretary take the roll for the motion to concur. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
And Senator Fateh votes aye.
Senator Fateh votes aye. All members having voted who desires to vote, the secretary closed the roll. There have been 35 ayes and 32 noes. The motion to concur prevails. The secretary will give the bill its third reading.
House File Number 4401, Senate File Number 4401, a bill for an act relating to cannabis, modifying cannabis business, hemp business, and cannabis event organizer license and endorsement provisions.
Third reading, Senator Port.
Thank you, Mr. President. Members, I first want to say a huge thank you, an incredible job done by Senator Dibble. This was a big lift, even though it's not a lot of massive change to the industry. It was a big lift to do. I do want to address some questions or concerns that have been raised about the Elk River site. Members, that site was submitted in June of 2025, but did not continue through the process to get approved. They only resubmitted their paperwork on May 12th of this year, 6 days ago. And the legislature has directed the office to recommend streamlining starting in 2024 and then again in 2025. During all that time, the current licensees and new licensees have been invited into that conversation and have been a part of that conversation. At no point was there approval or allowance for a new site with a larger canopy. So I think that that's important to understand. Really, the right sizing of this comes with the fact that it is at the same time being vertically integrated, which gives a huge bonus to these companies in this macro space now. They will be able to grow. They have the most retail locations of anyone. They can manufacture. They can sell their own products there. They can sell their products to other stores. They can sell their cultivation to other stores. And they can do their own transporting as well. They're the only businesses in this space that are allowed to do all of that. And with that huge benefit, and the release of being able to, or being required to spend a certain amount of their canopy on meds, came the right sizing of canopies. And I really want to thank our partners in the other body and the team here in the Senate that worked on this over months. It's a really important policy to make us really step forward into what this industry will look like over the next decades. And importantly, and I think the piece that was most important to Senator Dibble and to myself, was that this now requires that OCM keep a list of medical products that are needed for high-risk patients that are harder to get. And this is like for kids with epilepsy who need a specific non-intoxicating version. This is with folks who cannot consume, in other ways, who might need a liquid form, things like that because of cancers or epilepsy. This allows OCM to keep a list of those items that are required to be kept in stock by folks with a med license. And that is going to be so critical for our patients across Minnesota. That is what has guided Senator Dibble and I as we worked through this, making sure that that access is really clear and stays stable for those patients as the adult use market continues to grow. Importantly, we also allowed the hemp-derived cannabinoids to be used in adult use as they are allowed in medical and are allowed in other states across the country. This will give our hemp businesses an option to turn to if the federal government does not fix the market that they broke when they just outright banned hemp. So members, this is a really good bill. It's not super long or super complex, but it's important, and I encourage a green vote.
Members, any other discussion? Senator Duckworth.
Thank you, Mr. President. Just a couple of remarks. First and foremost, I don't think we should somehow fault a business out there for submitting an application no matter what date they submitted it on if it's under current standing law. Just because we're talking about and contemplating changes to the law here in this chamber for the future doesn't mean that we should somehow penalize or it somehow makes a business look like they weren't doing the right thing for submitting something under the current rules of the game. It's us who are talking about changing the rules, not that business. It's unfair to hold that against them. Number two, I think to somehow paint the licensing process of the Office of Cannabis Management in a positive light is probably the most humorous and laughable thing you could possibly do. And I think stakeholders and people on both sides of the aisle would agree with that statement. It might be better today But over the last few years, it's been utterly horrendous. And so I'm not going to fault that business for not being able to somehow work through the licensing process and figure out this, that, or the other when the state couldn't even figure it out itself. But here's really what I want to say, Mr. President, and that's this. The legislature, if we vote this bill through, it passes, there's one more stop it has, and that is the desk of Governor Walz. The governor loves to claim he is a protector and defender of small businesses. He's also apparently very fiscally responsible. I'm just going to let that hang out there for a second. But here's what the governor has the opportunity to do, Mr. President. Here's what I think he should do. He should veto this bill. Why? Well, if he's all about saving jobs, if he's all about supporting businesses, if he wants to signal to those who want to start a business or bring a business to the state of Minnesota or keep their business here, he could take a stand for them and say, we're going to protect you. We're not going to change the rules of the game. Laws here in Minnesota mean something. We will stand by our word. We're not going to pull the rug out from under you. The governor has a chance to save these businesses, to save these jobs, and to save these hardworking folks the living that they are earning and providing for their families, and I hope he does the right thing.
Senator Nelson.
Thank you, Mr. President. Well, I have the unofficial engrossment here, and I was just kind of looking through to see if the amendment that we adopted regarding labels was added to this bill, and I'm not seeing that, so I'm going to ask if perhaps it's in here and I just couldn't scan it quickly enough, if Senator Dibble will yield.
Senator Dibble, will you yield? He will yield. Senator Nelson.
Thank you, Mr. President. Senator Dibble, I am looking to see if those warning labels that we approved in this body are in the bill. Could you tell me about the status of those and what might have been included, or if not, if it wasn't, why not?
Senator Dibble.
Thank you, Mr. President. They were removed in the other bodies, Finance Committee, and I don't know exactly why. My apologies.
Senator Nelson.
Oh, thank you, Mr. President. Well, I cannot say how distressing it is to hear that when there was bipartisan support here, but even more importantly, certainly the scientific and health benefits of actually just having warning labels on the products. So I'm shocked that we're not even granting the same type of care to cannabis products that we do to cigarettes. Many of us have worked for a long time with tobacco-free Minnesota or making sure that there are appropriate warning labels. So I'm really disappointed to hear that that did not come back over, and I do appreciate Senator Dibble sending those labels over. I also want to just one more time speak about the dangers that we're seeing because of the limits that OCM has adopted. I just want to note that the majority of meta-analysis looking at potency and harm actually define what high potency is. And it's defined as greater than 10% THC content in flower. Just 10% is considered high potency. And yet, in Minnesota, the current OCM rules has no cap. Zero, no cap on potency for flower, which is shocking when all the data shows high potency is 10%. And there's all the meta-analysis also show that 50% THC cap on infused flower. So, members, I'm not going to be back here next year, but I am certainly hoping that somebody in this body will take up the banner of ensuring that our legal THC limits follow health, science, research regarding potency limits. And when we see what's happening in our society, we cannot sit still and think that not having potency limits or potency limits that are too high according to research, are in the best interest of Minnesotans. I'll just say one more thing. In 2024, the research published in the Journal of the American Heart Association found that daily THC use, either inhaled or edible, was associated with a 25% increased risk of heart attack and a 42% increased risk of stroke. So, members, it's just baffling that the state of Minnesota is so far behind this. So I am hoping that going forward next year that there will be people in this body who take this up to try and protect Minnesotans and at least give information about potency limits and warnings on these products. Thank you, Mr. President.
Any other discussion before we go to the author of the bill as the last voice we hear before we vote for final passage? Seeing none, Senator Dibble, for your final comments.
Thank you, Mr. President. Mr. President, just a few comments and then a few thank yous. Mr. President, I am very, very encouraged and even a little excited, strong words for a Swede, about this bill, because streamlining, as I discussed when we were first looking at Senate File 4401, is going to accomplish a lot for people who need cannabis as medicine and solving a lot of problems that have both been present in the medical market, in the medical cannabis program since its establishment when we passed it a little over 10 years ago. And those problems, of course, have been the function of how we established the market with only two large companies, what we call a duopoly, totally vertically integrated, limitations on the number of retail outlets they could have, and then the ensuing issues of proximity, availability, and expense. Keep in mind that people can't use their insurance; they have to pay cash, and it's just been not optimal for those. And then, as we've seen in the advent of the adult use market in state after state after state, the medical market, those who need cannabis as medical product, particularly those products that aren't just simply the plant itself, whole flower, those things that are synthesized, that are manufactured, that are derived from cannabis and hemp, it just atrophies and becomes either non-existent or just more problematic in terms of access and expense. And so this allows for greater efficiency, acknowledging that these artificial divisions on growing the plant, and in a lot of cases, everything that goes on behind the cash register up to the point of sale is just artificially divided. And so allowing for more businesses to get into the medical market, sending an economic signal to them to make that beneficial to them, it would help bolster and support the small businesses in this space continuing to fulfill and expand the original aspirations of the adult use bill that we passed a few years ago, having a craft market, a Minnesota homegrown market, and the like. Streamlining was taken under advisement and study, and a large consultative process occurred statewide among all stakeholders at the direction of the legislature, led by the Office of Cannabis Management. The fact of the matter is that with the very, very large players in the market, they would quickly overwhelm, without some sort of recognition of the efficiencies that are available to them, they would quickly overwhelm the smaller aspects of those small businesses that are just getting started and just getting stood up. So this, I think, right sizes and balances the market and responds to the emerging need over time. And so I think it's a very, very positive development. I want to thank Senator Port, letting me take over this legislation, although I'm very happy that She's continues to be my partner and helping me figure all of this out. And of course,
And
the
Senator,
amazing.
and Senator Dibble will continue to look this way
All
and
right.
not towards anyone
All right.
else. Senator Dibble.
I will point over my shoulder at Jackie Clinton and Amanda Peterson, who are just brilliant and have just done yeoman's work and done a tremendous job on this every step of the way. I encourage a green vote, and I thank everyone for the very, very vigorous conversation. As I said a few days ago, I very, very much respect the difference of perspective, and I'm glad we're able to have this kind of conversation and debate on the floor of the Senate. Thank you very much, Mr. President.
The Secretary will take the roll for final passage of Senate File number 4401 as amended by the House. Members, please vote. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Rest votes aye.
Senator Rest votes aye.
And Senator Hoffman votes aye. Thank you.
What was the last one? Senator Hoffman votes aye. Senator Hoffman votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Dames votes no.
Senator Daines votes no. Members, we're on a roll call vote. We're not supposed to be at other folks' desks at this moment. All members having voted who desires to vote, the Secretary will close the roll. There being 34 ayes and 33 nays, the bill is passed and its title agreed to. Members remaining under the order of business of motions and resolutions will revert to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce that the House has adopted the recommendation and report of the Conference Committee on House File number 4188 and repassed said bill in accordance with the report of the committee, so adopted. House File number 4188, the bill for an act relating to commerce, modifying various consumer protections for insurance and financial products. House File number 4188 is herewith transmitted to the Senate. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Senator Klein for a motion.
Mr. President, I move that the foregoing recommendations and Conference Committee report on HF 4188 be now adopted and that the bill be repassed as amended by the Conference Committee.
To that motion, Senator, will you explain what was done in the Conference Committee, the differences?
Mr. President, happily. What left this chamber was a very large bill. What comes back to us is one much reduced by many factors. First off, many of the signal provisions in the omnibus that we passed through the Senate floor then were passed as standalones, which is good procedure and a good precedent for future legislatures. The Senator May-Quade provision on notification passed as a standalone. A provision on trusted contacts for bank fraud passed as a standalone. The provision for the Hortman family experience of their insurance claims has been passed as a standalone. The telecom updates from Senator Rasmussen have been passed. Crypto kiosk ban, credit union language, and guaranteed insurance have all passed as standalone, so those are no longer in the bill. There are some provisions in this bill which are entirely new. We have adopted Senator Rest's expansion of the Consumer Protection Restitution Account from $5 million to $10 million into this bill. It is good language and will protect Minnesotans. We have adopted Senator Duckworth's meat raffle provision into this bill, and we have added the game of Hassenpfeffer to that provision. We have updated the effective date of the liquor bill that we passed a while ago so that it doesn't have to wait until August 1st to go into effect, and grannies can have happy hour as soon as we pass this bill. And then we made some 62J requirements on the Department of Commerce to pursue this question of care for disabled children who require 24-hour care, and I want to speak more to that. Here are the elements that are not in this bill because they simply could not survive through conference committee. One was Senator McQuaid's chatbot provision, which is good language and which we should look at in future sessions. The ban on pet stores also did not make it through conference committee. Members, perhaps the most difficult loss from this bill was a provision from Senator Boldon, which held to account the health plans which have dropped coverage, which they issued to patients for 24-hour home care for disabled children. These families go through tremendous strain. They purchased health care plans anticipating that they would have coverage under those plans for continued home care, which is good care, safe care, and the best care. The health plans unilaterally canceled that issue on their own. And these patients lost their care. They were forced to go on to medical assistance. They lost their supplemental benefits, and in many cases were forced to go into the hospital, which is worse care, more expensive care, and tragic for the stability and health of a family. It was wrong what they did. It was wrong that the Department of Commerce failed to hold them to account for doing it. We had a provision in the bill that you all voted for, many of you voted for when it left the Senate, that would have required health insurance plans to cover this care as they promised. That bill did not survive conference committee, and I know we'll have more discussion about that issue. And Mr. President, that is the bill as it stands before us.
Senator Abler.
Thank you, Mr. President. Thank you, Senator Klein. The passion shows in your voice, particularly about the home nursing care part. This is except for one element, this is a bill that I'd be happy to vote for. And so I voted on the way out the floor and with the hopes that something could happen in my former colleagues in the other body, Mr. President, our former colleagues, and I'm just disappointed about that. So would Senator Klein yield for a question, Mr. President?
Senator Klein, will you yield? He will yield. Senator Abler.
Mr. President, Senator Klein, could you, I read what's in the bill, and it's, it is, I can judge from the tone of your voice that you're not enthusiastic about it. Could you explain, just really briefly, it's 6 o'clock, but just kind of how the discussion went about this, and because I know there's House members and, other body members, whatever, out of body, Mr. President, members in the other body who, from both parties, who support this provision. And so can you just offer a comment about how it didn't come back?
Senator Klein to the question.
Senator Abler, there were 3 provisions that were in front of us in the conference committee that we felt probably should be managed at a leadership level. One was the question of reinsurance, re-upping the waiver. One was the issuance of Attorney General enforcement of 340B provisions. And the third was this language. And initially, we tried to take all 3 of those and send those to leadership negotiations so that they could be resolved there. However, we didn't stop working on this. We worked diligently. We had the opposition on the conference committee of House Republicans to this provision about disabled children's insurance coverage. We tried to come up with alternatives. We tried to create a mandate so that the Department of Commerce had to appeal to CMS to see if there would be defrayal costs, and if there were not, they would go ahead and implement this mandate. We, as I mentioned, created 62J language requiring the department to study good solutions to this going forward and require the cost benefit of doing this mandate in future sessions. And those were the compromises that we came up with, but we were not going to get the support of the House Republican caucus.
Senator Abler.
Well, thank you, Mr. President. I don't sell life insurance, but I know one thing that actually works about that is persistence. And so when you see the life insurance salesman like, oh, hey, how you been? Well, are you feeling safe in your family? You think they're going to be okay if you're gone? And pretty soon you just buy some because it's actually good to have. And by the way, Mr. President, are your policies up to date? Anyway. And so, people are watching. I've heard from just quite a few families who are worried about that. There's 250 families in this situation. We've had a couple of press conferences. The stories, as Senator Klein knows this and many members of this body knows, they're compelling. And I just don't feel at ease not giving it one more shot, Mr. President. And it's no disrespect to Senator Klein and maybe like the leadership people just didn't quite realize how important this was. And I do want to suggest as part of that leadership team, Mr. President, would be the governor, who actually runs the Department of Commerce through his commissioners. And I think if he would simply point his finger and say, make it so, could you please enforce the law that passed in 2010? Mr. Members, on your desks, you've got a copy of the presentation from Health Partners as part of their CMS package that says that this policy is unlimited, and they only changed it lately because they got away with it. And it's a problem. So, Mr. President, with that in mind, and I would not make this motion at 11 o'clock, but it's only 5 to 6, and this would not be a long insertion. I know Senator Boldon has an idea. But, Mr. President, I will move that the recommendations and conference committee report on House File 4188 be rejected, respectfully, and that the bill be returned to the conference committee as formally constituted for further consideration.
Thank you, Senator Abler. Senator Abler moved that the recommendations and conference committee report on House File 4188 be rejected and that the bill be referred to the conference committee as formally constituted for further considerations. Anything else to your motion, Senator Abler?
And a roll call, please.
Roll call requested, roll call granted. Any
And
other
I get to talk again anyway, so thanks. I'll sit down.
Any other discussion on the Abler motion? Senator Rasmussen.
Thank you, Mr. President. And I appreciate the senator from Anoka's passion on this issue, as I know that there's bipartisan passion around making sure that kids with needs and disabilities get the care that they need. However, Mr. President, I'm going to be opposing this motion today because I don't think it will actually result in them getting any additional care. And in fact, it would actually, I think, ensure that this 62J review process and the work that's required to happen between the Department of Commerce and the Department of Human Services, I think it'll delay that work from happening so that we won't have ready-made solutions for the upcoming legislative session. Mr. President, I'll remind the body that it's 6 p.m. and we have 6 hours left in this session to get our work done. And I think it's important that we not only have some provision that was able to come as a compromise on the home care nursing services insurance coverage, but in this conference committee report, there's a whole host of bipartisan legislation that is going to help Minnesotans afford insurance. It'll give Minnesotans access to short-term nursing care insurance, which they don't today. And so, Mr. President, I'll be voting against this motion. I think it would take a lot of good work that the Commerce Committee has done and throw it in the dustbin and ultimately not result in the action that the proponents of this motion would like to see.
Any other discussion on the motion? Seeing none, a roll call was requested. Oh, Senator Abler.
Well, thanks, finally. And I think people realize the hour is late, and I'm glad that people aren't talking about this to delay. I could not disagree more with my good colleague, Senator Rasmussen. There is time. If you've seen how quickly some things come together in the time, Mr. President, you and I have seen, I think that there are members in the other body on both sides of the aisle that want to vote for this. And I think that there's a lot of discussion going on about this very topic. And as I suggest, I urge members to vote yes to give us a little shot at it. And I know Senator Klein will do his very best. And if he comes back and says, I did the very best I could, then we'll accept that as his very best. He's already done his best. We just need more of that and one more shot. So members, please vote green.
The Secretary will take the roll on the Abler motion to reject the conference committee report. Members, please vote. Members, please vote. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes no.
Senator Carlson votes no. And would you be so kind as to talk a little more in the microphone, please? Senator Carlson votes no.
Thank you, Mr. President. Senator Rest votes no.
Senator Rest votes no.
And Senator Hoffman votes no.
Senator Hoffman votes no. Senator Rasmussen, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Dames votes no.
Senator Daines votes no.
And thank you, Mr. President. Senator Jasinski votes no.
Senator Jasinski votes no. Members, if I see you sitting at your desk, I'm going to close the roll. So I just want to give you that heads up. All members having voted who desires to vote, the secretary will close the roll. There being 19 ayes and 44 noes, the motion is not adopted. Members, we are now back on the underlying motion, which is the Klein motion, to adopt the committee report. Senator Holmstrom? This, you know, there's another opportunity unless you want to announce, say something on the adoption, because we do have to give it a third reading. Senator Miller.
Thank you, Mr. President. Under Rule 41.2, I wish to be excused from voting on the adoption as well as the final passage of this bill.
On that motion, all in favor say aye. Aye. All those opposed say no. The motion prevails. Any other discussion? All members in favor of the Klein motion to adopt, say aye. Aye. All those who oppose say no. No. The motion prevails. It is now adopted, and the secretary will give this bill its third reading.
House File Number 4188, a bill for an act relating to commerce, adding and modifying various provisions governing consumer protection, financial institutions, securities, insurance, unclaimed property, etc.
Third reading. Now, Senator Holmstrom, did you want to speak?
Thank you, Mr. President. Members, heard a lot of conversations about have some courage on bills. We just watched this bill sail through despite the knowledge that the good senator from Anoka gave us about the damage that it will do to people who live in this state. We had so little courage in this body, we could not send it back to conference committee to at least have the conversation. We have 6 hours left on the clock. 6 hours, and we couldn't find it in ourselves to try. I'll be voting no on this bill, and I would encourage my companions to do the same, all members to do the same. The damage does not outweigh the good.
Senator Boldon.
Thank you, Mr. President. I am incredibly disappointed that my provision that this body voted on and was included in our Senate package did not come back from conference committee. There was, discussion in that conference committee about this, and a report was adopted, and that is fine. It is good to have information, but it is not going to help the families who are dealing with this issue right now. It was mentioned in the conference committee that we should take a pause and gather more information. Well, the lives of these families are not going to pause, and the care that they need is not going to pause. I want to be really clear and have us think about who we are talking about here, because we are talking about largely children with complex medical needs who require intensive care in their homes. Were it not for this care, they end up in a hospital, and kids should be at home. That's where they want to be. That's where their families want them to be. And that care has been covered by private insurance plans for the last 16 years, because that is what this body required in passing a mandate in 2010. So for 16 years, that has happened, and it has worked just fine until last fall, when insurance companies realized a way that they could increase their profits and deny more care. They ripped the rug out from under these families, about 250 families across the state. And so I want to just for a moment talk a little bit about who those kids are, who we are talking about. We're talking about Chase, who's 5 years old. His dad says that he's medically complex. He has a tracheostomy, which is a life-saving breathing tube, a feeding tube. He's deaf due to bilateral hearing loss. His doctors prescribe 84 hours of home care nursing each week to keep him safe at home. We're talking about Nash. His mom says that he is prescribed medically by a qualified physician almost 100 hours per week of nursing care to keep him safe and alive. Without these nurses, he'd be back in the hospital where he spent the first 15 months of his life. We're talking about Sawyer, who is 5. His mom says that he requires home nursing care to keep him safe and at home and prevent hospitalization. He has an ultra-rare mitochondrial disease impacting multiple systems of his body, including his brain, muscles, respiratory tract, kidneys, eyes, and GI systems. His doctor has ordered 22 hours per day of home care nursing. We're talking about Lawson, who's 18 months old and medically complex. His mom says that he relies on a tracheostomy, again, a breathing tube, a ventilator 24 hours a day, a feeding tube for nutrition, and continuous IV medication through a central line to stay alive. His medical team has prescribed 168 hours of home care nursing each week because that level of skilled care is what keeps him safe at home and out of the hospital. We're talking about Xiomara, who is 5. Her mom says that she is medically complex. She had a lack of oxygen at birth, which caused brain damage on every level of her brain. She has no swallow or suck reflex, which requires frequent suctioning. She needs a ventilator to help her with her respiratory needs. She uses a feeding tube and has many seizures each day to her seizure disorder. She is quadriplegic and is not able to move herself and therefore needs frequent repositioning. Her doctors prescribe 168 hours of home care nursing each week to keep her safe at home. And lastly, members, there's a letter on your desk from Melanie, who talks about her daughter, Addison. And I'm not going to read the whole letter, but I encourage that you do so. And briefly, she says her daughter, Addison, has had 24/7 nursing coverage her entire life. She is medically fragile, complex, and now on palliative care. At the very moment when her body is failing and her needs are increasing, we are being forced to cut back on nursing hours because of newly imposed caps. We are being told to use your waiver, even though every family knows that that is not a real solution. Waivers run out, and waivers were never designed to replace skilled nursing, and waivers cannot keep a child alive. She goes on to talk about how they have been trained to revive their daughter, and they have had to do that multiple times because of the complexity of her medical needs. These are the kids that insurance companies are leaving behind. And so I want us to imagine, members, if you were a parent to one of these children and required that care for them to be safe and alive in their home. And what it would mean if one day out of the blue, your insurance company said, too bad, we're not covering that care anymore. Imagine what that would feel like. I will tell you that I don't have to imagine what it is like to have a kid with complex medical needs because I do. I know what it's like to have a kid with a tracheostomy and a feeding tube who requires 24/7 care and can't be left alone for 1 minute to keep them alive. And I know that the lives of these families are hard enough, that navigating our healthcare system is hard enough without also having to fight insurance companies for the care to keep their kids alive. It is egregious, it is outrageous, and it is unacceptable. And so I'm going to keep working on this issue. I hope later tonight we will be taking another vote on this and being able to actually do something to hold these insurance companies accountable and get this care to the kids as they need it. I'm disappointed that we couldn't move forward with it in this bill, but we will keep fighting it because that's what these families deserve.
Senator Nelson. I don't see Senator Nelson. I'm going to Senator McQuaid.
Thank you, Mr. President. And I want to thank the senator from Rochester, Senator Boldon, for her fierce advocacy for these families. And I don't need to tell the stories. She did such a beautiful job. I want to talk to this body about what the legislature did. In 2010, the Minnesota legislature passed a law that said home care nursing services shall be covered under plans if they are concurrently enrolled in their private insurance plan and Medicaid. They shall be covered. The other word for shall is must. Period. There is a period at the end of that sentence. There is no, here is the number of days, here is the cap. And for 16 years, the families in this state who have kids with complex medical needs who need nursing care to stay alive and at home have had coverage. 16 years. Until two insurance companies decided, you know what? We don't want to pay for it anymore. We're going to put in a cap, and we'll shift all of those patients over to Medicaid. Because that is what happens when people who are enrolled in a private plan and a Medicaid plan, when your private plan stops paying, Medicaid kicks in. Guess who pays for Medicaid? Taxpayers. So we have two ginormous insurance companies who make billions of dollars in profit or pay their CEOs tens of millions of dollars a year that are cutting off life-saving care to complex medically fragile children and giving taxpayers the bill when the legislature already wrote the law to stop it. It is absurd. It is egregious. And Mr. President, I want to say thank you to this chamber, because this chamber, both sides of the aisle, agreed we should do something about it. That is true in this chamber. I am not yelling at people in this room. The people in this room have stood up and said, that is wrong. Legislative intent was clear. But we are running into resistance in the other body, and it is infuriating that anybody would carry water for insurance companies who are going to kill kids and make Minnesota taxpayers pay for it. We have to have a fix in the next 6 hours. It is not an option not to. We cannot look these parents in the face and say, we did the work for the insurance companies instead of for you. Minnesotans are begging us to do something, and we should, and I will be alongside Senator Boldon as she continues this fight. Thank you, Mr. President.
Senator Abler. Senator Abler.
Thank you, Mr. President. So anyway, I appreciate the discussion about this. You know, here we are now. Senator Boldon has a plan. It'd be nice to find some way to fix that. And I don't always understand, Mr. President, leadership. Sometimes I wonder who is leadership anyway. And I've been wondering that for 27 years sometimes. But I think leadership exists when they're empowered by their rank and file people. And I do believe there's a lot of people in the body that want to work on this. But I'm trying to decide how I'm going to vote on the bill. And, you know, if there's no bill, then, Mr. President, there's no meat raffle, there's no happy hour, assisted livings where you can have a meat raffle. But those are really, I mean, those are nice, but they're so petty, with all respect to my good colleague here, than about the issues here. And so what we're left with is very ambiguous, bizarre language that the commissioner will look it over and check and see if it's really been around since 2010. Senator McQuaid, I mean, I think he has to verify that. And when he looks at that, he goes like, holy cow, this has been around since 2010. There is none of these extra costs involved. Why, looky there. And I guess that's better than nothing, Mr. President. I don't remember ever being kissed through a screen door. But I think if I had not been kissed in a long time, that kiss would be better than no kiss. At least somebody tried to kiss me. And this is what this is. And I just want to, I know what party I'm in, and I know what I care about, and I know what my other fellow members across the street care about, and they care a lot about this stuff. But I don't understand now why we still have to settle for a kiss through a screen door, but I guess we do. And so, Mr. President and members, if a kiss through a screen door is better than no kiss at all, then this is something you want to vote for, and I'm wrestling with that. Do I express my displeasure at the fact that this is such a poor kiss? So, Mr. President, I can't stop talking because I'm just grieving for the families that don't know what they're going to do. They do not know. Their lives are up many times, 18 hours a day or more, worrying about their child. Can I even get the care I need? And it just grieves me. And so I hope they know, as they're watching this, there's a lot of us that care about this. And maybe this little bit that maybe Senator Klein wrote to get something in the bill will be the answer. And I pray he's successful. Mr. President, one thing I do pray as well, that Governor Walz wakes up and realizes he still has like 6 months or so to be the governor, and he's still in charge of the Commerce Department, and he can go to that Commerce Commission and say, hey, by the way, it's a law. And I believe, Mr. Commissioner, it's your job to enforce the laws of this great state. And listen to Senator May Quaid's comments about it's not new. 2010, unlimited, Mr. President, unlimited, so these people can rest at night and their child doesn't have to grow up in a hospital or worse yet, expire untimely. So Governor Walz, it's time to do one more good thing before you leave office. This thing, I will tell you thank you for publicly 10 times, so please do the right thing. Thank you.
Senator Rasmussen.
Thank you, Mr. President. Would the senator from Rochester, Senator Boldon, yield for a question?
Senator Boldon, will you yield? She will yield. Senator Rasmussen.
Thank you, Mr. President, and thank you, Senator Boldon. And I appreciate your passion, your knowledge, your expertise, and your drive on making sure that Minnesotans with disabilities get the care that they need. And that is a shared goal. Mr. President, and my question for Senator Boldon, is there action that the administration could take, whether it's the Department of Commerce or the Department of Human Services, over the interim to address some of the challenges that you have brought to light, that I have heard about across the state? Is there action that these agencies could take over the interim?
Senator Boldon, to the question.
Thank you, Mr. President. Thank you, Senator, for the question. We have had many conversations about this topic, and I, in particular, have had many conversations, especially over the last few days, about this topic. I do think there are things that the Department of Commerce can do, and I encourage them to do so. I also think there are things that we, as the legislature, can and need to do to move this in the right direction as well.
Senator Rasmussen.
Thank you, Mr. President, and thank you, Senator Boldon. And I too, encourage the Department of Commerce and the Department of Human Services to address this issue with urgency. And I think one of the aspects that I heard about when it came to the home health nursing issue was a lack of appropriate notice and timing around some of these changes. And I think that that's an area where the Department of Commerce, as the regulator for health insurance, can and should play a role. Mr. President, I would say, with this conference committee report, there are bills that I wish were included in here that aren't in here. But when I look at the provisions that remain, that are included, I think they will help Minnesotans. And that's why I'm going to vote for this conference committee report today. And that's the question I take when I look at bills, when I look at committee reports that come to us, is voting yes going to further help Minnesotans address the challenges that they face. And while I would say there aren't many blockbuster bills in here, one that I wanted to talk about specifically would authorize short-term home health and nursing care coverage. And we know that the cost of long-term care insurance is out of reach for the vast majority of Minnesotans. And that's why well over 40 states have authorized this short-term home care and nursing coverage so that Minnesotans could have more coverage and protection against falling ill and needing to have out-of-pocket costs associated with that. I know we also have, I think, a really important provision in here on artificial intelligence and making sure that we don't have artificial intelligence being the only thing that would have an adverse determination for a Minnesotan who is seeking care. I think that's a smart, common sense protection that is included in this bill. And so, Mr. President, I'm going to be supporting this bill today. I think, while there are items that I wish were included, and there's items on the to-do list for the interim and for next year, I think the provisions in this bill reflect good faith, bipartisan, bicameral work that it would be a shame to throw in the dustbin here on the final day. Thank you, Mr. President.
Senator Dibble.
Thank you, Mr. President. Mr. President, members, I Hate to change the subject at hand. Senator Boldon, I stand with you, and I'm committed to be shoulder to shoulder with you to either find a solution in the next few hours before the gavel goes down sine die, or working with the administration to make the changes that are absolutely mandatory and necessary. Members, you might know that I've been working with a couple of the young people who were injured in sporting accidents, and their families are themselves facing financial devastation because they're not getting the help that they need. I want to change the subject briefly, though, Mr. President. I'm reluctant to do so because it's not nearly as serious and dire and consequential a matter as we're discussing, but I did just want to point out quickly that a measure that was brought into the conference committee by Senator Klein, the inclusion of the changes to our pet shops, was offered by a member of the Senate conference committee, probably a motion by Senator Klein, and on a unanimous vote by the other party on the other side was not accepted into the conference committee report, despite the fact that we passed this bill off this floor on a bipartisan basis, and in the other chamber, it has multiple authors from both parties and a strong indication of support, more than well over the threshold needed for passage in the other chamber. But the proverbial leadership of the Republicans in the other chamber have put the kibosh on allowing that measure to pass. Members, this is not a trivial matter. It's very, very important, of course, because we are judged by whether or not we are a humane society. In those places where this change has been made, we have seen the reduction in puppy mill production by over 40%, approaching 50%. That's 550,000 dogs that are not raised in these inhumane and shocking and appalling conditions. This is after this legislation came to this point in this chamber and in the other chamber after many, many years of hard work and movement building and advocacy on the part of many, many people, much effort, and it's gotten to this really, really strong position that a lot of people care about, an important change to be made, and cynically, simply interrupted by a decision of the other side of those at the highest levels for reasons that I can only speculate on. But it's a shame, it's a missing provision. We will come back next year or the year after, we will make this change in Minnesota. I thank Senator Klein for his advocacy, and I just express disappointment that our partners on the other side didn't see fit to making this change despite all of the effort that has gone into its passage and the arguments and the compromise and everything that's been done to get it to this point. Thank you, Mr. President.
Senator Seeberger.
Thank you, Mr. President. I'm going to be a yes on this conference committee report, and I want to thank Senator Klein for all his hard work and all the wonderful provisions in this report. I want to thank Senator Abler for so eloquently describing the problem that we ran into as we were trying to get this conference committee report across the finish line. I want to thank Senator Boldon for her highlighting of the issue that I know is very, very personal to her. And let her know and let you know, Mr. President, and Senator Abler know that I stand with you both in this fight. I'm in conversation with people. I'm hopeful that we can find a solution here in our last almost 6 hours in session. I'm going to do everything I can to find a resolution to this problem, but I will be a yes on this with the hope that we can find a solution here shortly. Thank you.
Senator Nelson.
Thank you, Mr. President. Well, I rise because there's a very important provision that this body passed that did not come back in conference committee, and it's simply the provision on broker-dealers and investment advisors, and it actually the rule, and now it's being placed into statute itself, isn't the problem, which is that investment advisors and broker-dealers have to adhere to supervisory policies. Well, that makes a lot of sense. That's not a problem. But the problem is when they have no one to supervise. We passed an amendment in this body that would exempt the need to write written supervisory procedures when you don't have anyone to supervise. And so it's a little incredulous, quite frankly, that got stripped out in conference committee. I can only imagine it might be the Department of Commerce itself. I'm not sure why someone would strip that out. And it's an example, quite frankly, where sometimes our departments do things that are they just don't make sense. They create more paperwork, more cost, more time. Why would you write a supervisory procedure if you don't have anyone to supervise? We know that the CFP, the investment advisors, they all have rules and regulations they need to follow. This industry is a very highly regulated industry, and it's shocking that the Department of Commerce, I assume, is the one that says, but you know what, you don't have any employees, but you still got to write a written supervisory procedure. So I'm sorry that this kind of ridiculous piece is still in after our body here wisely voted to remove it.
Senator Limmer.
Thank you, Mr. President. I've been listening carefully to our discussion. It's unfortunate that we had the vote to not send this bill back. Quite honestly, I have to ask a question of this body. What are we here for? What are we here for? The state constitution gives us a hint of what our purpose is. It's so important that it's Article 1, Section 1 of our state constitution. The purpose of government is the safety of its citizens. I hope you remember the oath that you took to that constitution. Now, you made your decision. Apparently, we're going to leave that little kid in my district, Chase, 4-year-old little boy. Looks like he'll be deserted within a few months. And an insurance company who's licensed in the state, who pursued licensure, knowing full well what the law was in 2010, that the coverage should continue, might just have their way tonight based on what we do. Senator Boldon made mention that she's working on a possible solution before midnight tonight. Well, I've learned that over my time, 6 hours in the legislature at the last hour, the last day, it's a lifetime. It really is. You can get a lot of things done in that short period of time. But I'd also like to ask the question and compare that to 4-year-old Chase. If his trach tube comes out, he can't breathe. He can't breathe. There's close to 2,000 other kids in the state of Minnesota that have similar problems. They have complexities with their health condition. And I've seen a lot of things in the legislature of how we show our compassion in trying to help people that can't help themselves. I sincerely hope that this is not going to be the beginning of a new era in Minnesota where we now are getting a little more coarse with our compassion. Well, I'm going to do what I can to help Senator Boldon in the few hours we have left. I think we all should. Because quite honestly, I hope we aren't turning a page in Minnesota where we turn our back on a little kid, 4 years old, whose parents are going to be challenged by the enormous expense when they enrolled in the insurance program that said that they could get that coverage under the power of law. I'm kind of surprised that this article in our original bill came back without it being in the bill. And because we fought for it. Everyone knows how they voted and what was at stake. And I hope we're not so quick to judge that we're just going to turn our back on the kids of Minnesota and the parents. I suppose we can just cram them into a hospital. Mom and dad won't be able to be there all the time. Kids will languish. They might get the medical coverage that they need. But I've heard some things about nurse shortages in hospitals as well. And if trach tube comes out, maybe they'll get to that kid in time and maybe not. So I really hope that we're not being too casual tonight in quickly trying to pass bills and kind of cast off some of the little issues that seem to be inconvenient. Because inconvenience, I can only compare with the plight of parents. The inconvenience of having a child balancing within a minute or two of living or dying based on a medical equipment failure requires an attendant. I can't imagine what a little kid would feel, little 4-year-old taken out of a house, put into a sterile environment like a hospital, and sometimes the nurse will come by, and sometimes they won't come by for a while. They have other challenges. They have little emergencies on the house or on the hospital floor at another end of the wing. Let's just hope that that trach tube doesn't come out. It just makes me continue to ask that question that I started with. What are we here for? What are we here for? Now, we spent a lot of money. We've raised a lot of money in the last few years through taxation and spending requirements. And I'm just surprised that we cannot find the resources to take care of this problem, because it really isn't that big. I suppose it's big for an insurance company, but there also comes responsibilities with businesses as well. So Senator Boldon, I hope to work with you tonight. Hopefully we can find some kind of solution somewhere, somehow, because quite honestly, that is what we're here for. Thank you, Mr. President.
Senator Liskey.
Thank you, Mr. President. It's going to be tough to follow Senator Limmer's discussion that he just had. I think it's the same feeling that I'm having. We have a responsibility in this body and in this building to represent those who can't come and represent themselves. We had an opportunity just a little while ago to send it back and get it right. And unfortunately, the majority chose not to do that. And I don't know if it's for expedience or for ease or for a group that they represent that felt like it was going to hurt them in some way, but the reality is these young people who are suffering made a deal. They had a contract. They were under the impression that they were covered, and now the state is going to have to pick up the football for that situation. The problem is it's going to cost more and the care is going to be less. I don't understand why we're continuing to go down this path. We had the opportunity to fix it here, and now we have 6 hours to try and fix it in a different way. And I just don't see how or where, but I'm hopeful. And just like Senator Limmer said, I would pledge my assistance in any way, shape, or form to Senator Boldon. And I look forward to finding that solution in some way, shape, or form. So with that, I urge a no vote here, but I don't know what else to do. Thanks.
Senator Duckworth.
Thank you, Mr. President. I'll be very short. I'm a yes on the provisions in the bill, but this is the important part of the conversation that was highlighted earlier. We're sometimes forgetting to reference. There may be 6 hours left today. The governor can make one phone call tonight and solve this issue. I suggest he pick up the phone and make that call.
The author of the bill, Senator Klein, and then we will vote.
Well, members, thank you for your passion. I'm humbled by it and moved by it and inspired by the humanity within the body today. I join Senator Boldon and Senator Limmer in committing to do what we can in our brief time remaining. And I agree with my colleagues who have said that things can be done outside of a legislative body as well to ease the pain for these families. That said, members, your vote today, green or red, does not reflect what's not in this bill. Your vote is a reflection of your approval or disapproval of what is in this bill, what lies before you. Senator Rasmussen spoke to a couple important provisions that will help Minnesotans. Refusing to let artificial intelligence make medical denials and insisting that that's done by a human being. Paying trainees in mental health full wages so that we can improve our mental health access in this state. An expansion of Senator Rest's consumer protection restitution account so that people who have been defrauded can seek recompense. These are important things and they will help Minnesotans. They have earned your green vote. We are not voting on what's not in this bill. We're voting on what's in this bill. Please vote green.
The Secretary will take the roll for final passage to House File 4188. Members, please vote. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Rest votes aye.
Senator Rest votes aye.
And Senator Port votes aye.
Senator Port votes aye. Senator Rasmussen, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Jasinski votes aye.
Senator Jasinski votes aye. All members having voted who desires to vote, the Secretary will close the roll. There being 49 ayes and 15 noes, the bill is passed and its title agreed to. Senator Murphy for a motion.
Thank you, Mr. President. I move a call, to the call of the President for about 30 minutes. Members, DFL members, we will caucus upstairs.
Senator Johnson.
Thank you, Mr. Chair. Oh, sure. All right, two things. Number one, we're going to caucus, well, we'll just caucus upstairs and then we'll be back down for the remainder of the session.
On the Murphy motion, all in favor say aye. All those opposed say no. The motion prevails. The Senate is now in recess to the call of the President. Senator Murphy.
Mr. President, I impose a call of this. Mr. President, I move that further proceedings under the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Members remaining under motions and resolutions, I'm going to call on Senator Hur for a motion. Senator Hur.
Mr. President, I move that the foregoing recommendations and the conference committee report on Senate File 2077 be now adopted, and that the bill be repassed as amended by the conference committee.
Senator Hur, will you be so kind as to explain the bill for us, please?
Thank you, Mr. President, and I try to be expeditiously. There's a couple categories here, and one section is on unemployment benefits, and maybe Senator Hawj can talk about that. And also there's the agriculture utility, AURI section, and the deadline extension that include electronic licensing system, park control, and also the car barrier extension. The core of this bill is the Outdoor Heritage Fund section, which I carry in the Senate, and as one of the old saying in India said that it takes many paths to reach one destination, or you can take many trains that can reach one destination. So I'm glad that this outdoor heritage bill has traveled through many paths and finally ended here to one destination. I do ask members to support. Members, Minnesota identity is deeply embedded in our lakes, streams, prairies, wetland, and woodlands. The Outdoor Heritage Fund help us protect, restore, and enhance this habitat for our future generation and enjoyment benefit. And just a little background that this is a 2008 legacy amendment that passed with popular support for that purpose. The Outdoor Heritage is one of the 4 legacy amendments that received 33% of the total fund. The statute directive authorized the Lessard-Sams Outdoor Heritage Council to review and recommend proposal to the legislation. I want to thank Senator Andrew Lane, who served with me on the council. And the recommendation this year, funding received unanimous support from members of the council with 53 programs and totaling $191 million in funding appropriation. This bill appropriation will protect, restore, and enhance 68,000 acres and wildlife habitat and 40-mile shoreline throughout Minnesota, leveraging over 15 million of federal and local government and private conservation fund. The Rosal project is also in this bill with modified language that was provided by Minority Leader Johnson to make sure that they don't carry any take any expense or take any action for another year, and to also put a pause when there's legal injunction take place. Also, the language include hiring process and of executive director and term limits for boards. And I appreciate the work that Senator Lane and I worked together on this. So remember, that's pretty much it. There's the land bill provision, there's the RE provision, there's a unemployment benefit provision, and those who are responsible for that may speak on that behalf, but this is the bill, Mr. President.
Members, we're on the motion to adopt the conference committee report. Senator Hawj.
Thank you, Mr. President, and thank you, Chair Hur, for this bill. I want to talk a little bit about the unemployment extension that is in this bill. As many of you know, in the state Senate over the last couple of years, we have had some circumstances where some of our mines up on the Iron Range are idled. And we are grateful on the Iron Range delegation that our colleagues have come together to provide an extension in unemployment insurance for those laid-off steelworkers. The reason that this is particularly important on the Iron Range is because our mining economy is central to our overall economy in the region. It's the equivalent when a mine goes down on the Iron Range that a big corporation in the Twin Cities would be going down and laying off their workers. For example, Target or 3M or one of those industries in the Twin Cities. So it's a huge impact and has ramifications for our region. Last year, we passed an extension for Hibtac and Minorca miners, and unfortunately, there were some additional layoffs that occurred at Hibtac that did not fall within the timeline of the extension that we passed. And so there are just a few additional workers that we're looking to ensure that we're treating fairly with the unemployment extension that we passed for the miners at Hibtac, and can make sure these ones get it as well. But I want to bring up another broader point, which is I'm really, really proud of the work in particular that we have done in the state Senate this year, having the backs of Minnesotans when they're facing tough times. Here in the state Senate, we have stood up and reached our hand out for the folks that were impacted by Metro Surge in the Twin Cities. Through work by Senator Champion to extend benefits for businesses impacted by Metro Surge. Those workers and those businesses deserve to be recognized and to be supported as well. We've provided rental assistance to those that were impacted by what happened in the Twin Cities as well. This is what we do in Minnesota, right? We have each other's back. We look out for one another when we need it most. And that is what we in the state Senate have continued to lead on. And it's not lost on me that whether it's the Iron Range or Minneapolis or one of our other rural communities in greater Minnesota, that we in the state Senate are constantly there to make sure that we have the backs of Minnesotans and that we support them in the time of need that they have. So I just want to thank my colleagues for their support for the extension in unemployment for these Hibtac steelworkers, and appreciate everything we've done this year. Thank you, Mr. President.
Senator Green.
Thank you, Mr. President. I've been following this bill since it was first enacted, even before I was in office. And I've watched the way the funds in this bill have been spent, and it's bothered me ever since. And even though there are some needed reforms, and I have voted for this bill in the past, Mr. President, when I was served in the other body, if we got good, solid reforms in the bill. And there are some reforms in this bill that I do like, but this bill, in the years that I've served here, and the 18 years that this has been, and I've never seen a bill this bad with the outdoor heritage funds. And since this thing came into existence, the legislature has taken the recommendations of the Outdoor Heritage Council and treated them as if they were gospel. Whatever the Outdoor Heritage Council sends over, that's what gets approved by the legislature. And I don't think that's the way it's supposed to be. They're supposed to make their recommendations, and we're supposed to vet those recommendations and see if they're worthwhile or not. And we have the ability to do that, but it seems like there's just not the desire to actually look into some of these bills and make those hard, well, they're not really hard decisions, it's just decisions that maybe would take some time. This particular bill actually buys more land than I've ever seen in one bill. There's 35,000 acres of land that's being purchased in this bill, and a good share of it is not going to be going back to the state. It's not going to have the payment in lieu of taxes, which we'll talk about in just a little bit. But 30,000 of those acres are in 2 counties. And they're not my counties, but they are counties that are in the 90% range already owned by the state or federal government, the St. Louis and Cook County. And so I did pass some stuff out, Mr. President, and it should be on the senator's desks by now. In St. Louis County alone, there's 20,000 acres that's being purchased here, and probably around 10 in Lake County. The impact to the property taxes, losing that, and you'll see that in stuff I handed out that I got from staff, and actually it came from St. Louis County, $183,455 in property tax that's now going to be shifted somewhere else instead of being paid on what was formerly private lands. 95,730 of that is going to be shifted to every other Minnesotan. People don't realize that payment in lieu of taxes, or PILT, actually comes from a open allotment in the general fund. We don't get to vote on it. It's just that if the state buys land, automatically money comes out of the general fund to pay the payment in lieu of taxes. The other half of that, the 87,725, is going to have to be picked up by the property tax payers in St. Louis County. So property taxes are going to go up in St. Louis County for the few acres of land that's left there. And the people of Minnesota are going to pay the rest in perpetuity. The state of Minnesota right now, and we've talked about this before, if it's not at a third, it's running really close to a third of the mass of Minnesota is in some form of public lands or water. And not all of that gets PILT payments. If it did, the state would be on the hook for a lot more. But currently, every year, $49 million comes out of our general fund and goes out to payment in lieu of taxes. This bill, all by itself, will add another $342,000 a year in general fund money into those PILT payments. And that's expected to rise. That'll shove that over $50 million a year, and it's expected to rise by $1 million every year. When the land for in these two counties come up for sale, it actually belonged to people that cut the trees, whether that be Blandon or Potlatch. And they could no longer afford to do business in Minnesota, so they started selling off their land. And right away, an entity called the Conservation Fund, pretty short, simple name, it's just Conservation Fund. But the Conservation Fund gets a large portion of its money from entities like Goldman Sachs and BlackRock. And they fund conservation funds so that they can come in and buy land in Minnesota that comes up for sale before any other private citizen has a chance to buy it. And then in turn, they turn around and things like the Outdoor Heritage Fund or the LCCMR, they buy the land back from the Conservation Fund. So land comes up for sale, gets taken away from any chance that a private person might have to own that land, gets bought up by entities like the Conservation Fund, and Minnesota taxpayers come in. Most of them have no idea that this is going on. And not only are they buying it back from this entity, now they're on the hook for the property taxes as well. These two pieces of land, St. Louis County and Lake County, are going to cost $32 million of taxpayer money. $32 million for 30,000 acres of land. And that's not counting the other land that's bought up in this bill, which adds up to another 5,000 at least. And the other thing, too, is what you might hear is that there's probably some idea that this land is going to somehow be able to be harvested for trees, logging. But this land is going to become a WMA, a wildlife management area. And this year alone, we've been trying to fight back entities that are trying to say you can't manage the forest on a wildlife management area. And if that continues to go forward, we're going to have another huge parcels of land in Minnesota that no longer get managed. And we have a lot of land in Minnesota that doesn't get managed. So that's the one portion of the bill. I'm going to go through another portion that Senator Herr mentioned, and then I'm going to walk through just a few other things in the bill that's there. Another portion in this bill, and if you look up the project, nobody ever seems to read the projects, but I go through those books. And one of the projects is the Roseau Lake project, and I thank Senator Johnson for getting some protections in there, but there's $3.5 million. And if you look in the book, it'll tell you that it's going to enhance 3,000 acres of wetland and 1,900 acres of habitat, but in the papers that I handed out to you, you'll see some engineers' reports that say that they're missing some things in there. And what they're doing is they're building dikes to flood back land. And some of it, you'll see already has been flooded back. And in some of the reports I've seen, that this could be as much as 12,600 acres of farmland. In committee, one of the DNR folks came in and testified that what they want to do is flood back so that there's about 18 inches of water up there, which is really good for nothing except mosquitoes. You might be able to get a few geese in there, but keep in mind, Mr. President, that we battle the avian flu every year, and we know that the avian flu comes through migrating birds. So we're building sanctuaries to house birds that are going to bring avian flu into the state, even more than we have now. This particular project started being planned about 14 years ago. Landowners started pushing back and trying to get answers. They didn't get any until finally a couple years ago they actually filed a lawsuit to try to stop it. And right now there's about 100 property owners up there that are saying they don't want this, and yet it's still in the bill. And so I'm asking where the vetting is on that. Did anybody go up and talk to the landowners? Happens all the time in both this and other bills where you see what the projects are, but nobody ever takes the time to go and find out what unintended consequences are, how it's impacting the landowners around that project. It's not unique. Watersheds are doing this all the time. U.S. Fish and Wildlife does it too. I've got incidents of that as well, where the U.S. Fish and Wildlife come and just block a stream, block an outlet, and water starts backing up on people's private property. I talked to a guy the other day, actually, and the ag commissioner was telling me about a farmer who had to walk through water and get to his barn because his barn had been flooded by some of the projects that were done. This particular project up in Roseau Lake has been devastating to the people up there. They've farmed this land. According to some of the reports I've seen, this is probably some of the richest ground in Minnesota. It was from what was called the old Roseau Lake that was drained back in the 1900s, but I haven't gotten all the stuff on it yet, but I suspect it wasn't really a lake or it wouldn't have been able to be drained, and it was a total of 500 acres. And for us, 500 acres seems like a lot, but in the scope of a lake, it's not very big at all. And yet, here we are, still in the bill. And that project also talks about this being the final phase, but it talks about it being so many phases are finished, and phase 3. However, in the paperwork on it, that's not what it says. It actually says phases 1 through 4 were funded. So I don't know why they're calling this phase 3. 1 through 4 were funded. 3 and 4 aren't done. And there's going to be phases 5 and 6. But I've talked to the folks up in Roseau County, and they say phase 2 isn't even done, and yet we're putting more money into it. It doesn't make sense. Some of the other provisions in the bill, and I've had this conversation with other people, because I don't think these projects are vetted. People on the council will tell you they are, but You've got projects in here, some of them in the metro area, that they're actually going to do flyways for wild migratory birds. And again, these birds are carrying the bird flu. These are the geese that roam our parks. I don't know what you guys think about the metro area, but where I'm from, we're really getting tired of the geese in our parks. You can't walk through the park with bare feet. They chase people. And yet, in these bills, we're spending millions of dollars to flood back land so we can have more of them. And I won't read them all, but there's a lot of them. But I just open up the first page. DNR Wildlife Management Area, Scientific Natural Area Acquisition. $360 are going to get, or 360 acres are going to get pilt. And where is it at? We don't know. Here's $3.5 million. Go buy 360 acres somewhere. There's one in here for the metro, urban and metro. I think the one is $6 million. Where are you going to get the land from? We don't know. Doesn't say. Doesn't say where the land is. Just go find some and let's buy it. Another 553 acres without pilt somewhere in Clay, Ottertail, Meeker, or Candy, Ojai counties. $5.4 million. Here you go. I can see why entities like Goldman Sachs and BlackRock come to Minnesota to buy land. It's really easy to get money. Between Ducks Unlimited and Pheasants Forever, just in the projects that they're listed in, not counting the little residual they get, there's $32 million that's going to go through them. You know, I don't know that we're going to be able to stop this bill. I think this bill is going through, especially when they add so many other things to it. But we need to do a better job at this, Mr. President. We need to know what we're voting on. This bill is almost $200 million, and this is just 1/2 of 1/3. Our legacy funds are going to be reaching, if they don't by next year, very soon, $1 billion every 2 years. It's not small change anymore. It's a lot of money, and we're not paying close enough attention to it. So, Mr. President, I'm not going to tell people how to vote on this bill. I don't like doing that. People have to vote how they want, but this is what's in, some of the things that are in the bill. And before you put your green button up on some of this stuff, I would hope that everybody here would at least take the time to say, how are we spending tax dollars in Minnesota? And what's the implication? Thank you.
Senator Weber, is it okay if I adopt, or do you want to speak before the third reading? Members, we're going to the third reading.
I'm asking for a roll call, Mr. President.
Roll call requested, roll call granted. The secretary will take the roll for adoption of the committee report. Members, please vote. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Port votes aye.
Senator Port votes aye.
Senator McEwen votes aye.
Senator McEwen votes aye.
Thank you.
All members having voted who desires to vote, the secretary will close the roll. There being 41 ayes and 26 nays, the committee report is adopted. The secretary will give the bill its third reading.
Senate File Number 2077, a bill for an act relating to state government appropriating money for environment and natural resources.
Third reading, Senator Weber.
Thank you, Mr. President. Would Senator Hur yield?
Senator Hur, will you yield? He will yield. Senator Weber.
Thank you, Mr. President. Thank you, Senator Hur. One of the projects included in this report is the Roseau Lake Rehabilitation Project. Now, it's my understanding that that project was originally removed by the Environment Committee and put back in by the Finance Committee with stipulations. As I understand, the concerns that revolve around this project are with property owners that have had their land flooded and therefore unavailable to their use by this particular project. This is land for which they have not received compensation, but which has in effect been taken from them. What my question for Senator Hur, Mr. President, is what are the stipulations that the Finance Committee put in place?
Senator Hur, it's my understanding he wants to go to Senator Johnson, whose provision it is. Is that correct, Senator Hur?
That would be just fine, Mr. President.
Senator Johnson.
Thank you, Mr. President. And so this is part of a long-running controversy in my district regarding the Roseau Lake bed project in there. We have two parties. We've got the watershed that's doing the project itself. We also have some concerned landowners. And as they've been working through this process and this project, the watershed district has been trying to accommodate the landowners' requests. From my understanding and from what I've seen over this project itself, they have accommodated fully to protect the landowners that may or may not be impacted by this. The language that I put in finance was another opportunity for landowners to submit an injunction on this in case they were able to prove in court that they were going to be impacted by that. So I gave some time, delayed the funding for that so that there would be time for the landowners to file injunctions. It's been going on for 7 years. There's been quite a bit of the work done already. And so what is being financed in this project through Senator Hur's bill is going to be the remainder if the courts determine that the impact to landowners is not going to actually happen. So I tried to thread the needle between the landowners and those within the county and the city itself. We've got letters, resolutions from both of the county and the city of Roseau supporting this unanimously on those. So that's where we are on it. I think we have some safety language on this. I know there's some concerns within the body, but I think it's a good project and weighs out the interests of both the landowners and the watershed. Thank you.
I'm going to go back to you, Senator Weber. I'm just going to let someone know who sent me a text that Senator Weber is speaking and he asked for someone to yield. Senator Weber, it's back to you.
Thank you, Mr. President. My question then would be if Senator Johnson would yield.
Senator Johnson, will you yield again? He will yield. Senator Weber.
My question is there a specific time period in which this injunction has to be put in place and a decision made, or will the funds be withheld until there is a final determination?
Senator Johnson, to the question.
Thank you, Mr. President. And yes, I believe it's a 6-month delay on the funds. So if an injunction is not put in place within 6 months, the project or the money will be released and the project can be finished up there in the Roseau Lake area. But if an injunction is placed by the court, then the money will not continue flowing forward. So usually when they go to court and try to get an injunction, they have to prove out the case to a pretty significant manner. So that does give me some assurance that the landowners' rights and their property will be protected in this process.
Senator Weber.
Thank you, Senator Johnson. Thank you, Mr. President. I just simply rise to say that I am always concerned when we have landowner rights involved in these projects. And if indeed there is land that has been flooded without proper compensation for the property owners, they have a cause for a judgment or a court case against the state of Minnesota. And I would hope that it would be CCR funds that are used to pay for our defense rather than money from the general fund. Thank you, Mr. President.
Senator Lang.
Thank you, Mr. President, and thank you, Senator Herr, for bringing the bill tonight. I know most members probably aren't super aware of what goes on in the Lessard-Sams Outdoor Heritage Council or exactly how much we meet, but every year I got to remind everybody that we get a huge 3-ring binder at the beginning of our cycle, and in that 3-ring binder are perhaps hundreds of applications for funding for outdoor heritage projects, excuse me, Mr. President. And what I would say is those projects range forests, wetlands. They range, if anybody can see in the handout, they range from all sorts of metro, urban, northern forests, prairies, southeast forests, all these projects that we've been funding now for almost 18 years. This is the legacy amendment. This is a voted on amendment by the people of Minnesota that has gone on for quite some time. It is a huge process for the council to weed through these project applications and fund the ones that we see are most fit to be funded. A lot of work goes from citizen members, a lot of work goes from both legislators and the leadership group within the Lessard-Sams Council. What I would say is I appreciate Senator Herr by accepting some very worthwhile amendments as this process has gone on. I think it will help to shape the council into the future. You know, I've been on this council for 8 years, Mr. President. And I can tell you that in that 8 years, it is very hard for me to explain what exactly that council is to the rest of the legislature. The rest of the members in this room right now that probably have no idea what Senator Green has been talking about, probably have no idea what I've been talking about. They just know that it's $191 million. That's a significant amount of funding, Mr. President. In the 18 years the council has been in existence, I can tell you that it has had a very narrow scope of view. A narrow scope of view that has been largely land acquisition, largely turning pieces of private property into possibly WMAs, wildlife management areas, Mr. President, or scientific and natural areas, or something that has public value and really has habitat value. That scope, in my viewpoint, and this is to Senator Green's point from earlier this evening, should probably change a little bit, members. As we go forward, 18 years into this process, we've bought over 1 million acres. 1 million acres, Mr. President. 1 million acres is expensive to take care of. As this council goes forward, I would like to see some guidance from the legislature. I would like to see the legislature, both sides of the aisle, come together and say, you know what, 1 million acres may be enough. 1 million acres of state property may be enough. Maybe we should look towards the constitutional amendment that we passed in 2008 and say, you know what, this is restore, enhance, protect. What does that mean, Mr. President? What does restoring mean? Does that mean buying land every chance we get on the council? Or does it mean maybe we should look at some of these streams in rural Minnesota that need help? Some of these, you know, pieces of property that have been eroded. Maybe that's what we should do. And this is to the applicants. For all of the applicants that come to the Lessard-Sams Council, start thinking about that. Start thinking about this. Maybe we shouldn't always be buying property. Because, Mr. President, in northern Minnesota right now, there's a lot of counties that are mostly government-owned, whether it's state or federal property. There are many places that are owned by federal government that aren't paying taxes. And those local communities, those local jurisdictions like counties in northern Minnesota that are really hurting, really have a low tax base, this is only adding to the issue. So again, Mr. President, thank you, Senator Herr, for the bill. Thank you for bringing it this evening. I think it is a good compromise bill. I think we are getting there. I think the council is going to shape up nicely in the next few years, and thank you.
Senator Farnsworth.
Thank you, Mr. President, and I'll make this quick. I know we still have a lot of business to do tonight, but I just want to thank Senator Herr, Senator Hochschild, members of the other body who are on the conference committee for including my favorite provision, the UI provision. And it's interesting, I'm reminded every once in a while in this job that people are actually watching. In the last couple of days, I've had union presidents texting me, and yesterday they were happy because we thought we had this provision in another bill. And they were excited, and then they found out, well, no, maybe that one's not going to move. And then this morning, maybe it was going to move. And they've been watching this, and I can tell you that they're very grateful that this provision is being included in this bill. It means something to our region, and so to everybody involved to make sure that we could get this provision across the finish line, I just want to say thank you for supporting the Iron Range. Thank you, Mr. President.
Members, before I go to the author of the bill, any other discussion? Seeing none, Senator Herr, your last final words before we vote.
Thank you, Mr. President, and as a compromise, good compromise bill. Senator Lane already explained quite a bit about the process. I just want to add on to it that, when you mentioned about transition to WMA is not going to happen overnight. There's still a process. Even though there's a acquired wetland or forest, it still takes some step before it becomes WMA at later point. So it's not happening tomorrow. But this is a good compromising bill, and this is the last stop before going to governor's desk. So I ask members to vote on this bill. It has bipartisan support, so I'm counting on all of you to vote this bill. Thank you.
The Secretary will take the roll for final passage on Senate File Number 2077. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
And Senator Port votes aye. Thank you.
Senator Port votes aye. Members, please vote so we can move expeditiously. All senators having voted who desires to vote, the Secretary will close the roll. There being 46 ayes and 9. All members having voted who desires to vote, the Secretary will close the roll. All members having voted for the third time How would you like to vote, Senator Limmer?
Mr. President,
How would you like to vote, Senator Limmer?
I would like to vote no.
Limmer votes no.
Thank you.
All senators having voted, who desires to vote, the secretary will close the roll. There being 47 ayes and 20 nays, the bill is passed and its title agreed to. Members, there's an author's motion at the desk. The secretary will read the motion.
Senator McQuaid moves that her name be stricken as chief author, shown as co-author, and the name of Senator Boldon be added as chief author to Senate File Number 3967.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Senator Murphy for a motion.
Members, we're going to recess for about 30 minutes. Members of the Tax Committee are going to be in G15, as Senator Rest will tell you, and then I will move a recess to the call of the President.
Senator Rest.
Thank you, Mr. Chairman. All members of the Taxes Committee are invited to this hearing to review the DE amendment on the tax bill. Thank you very much. Immediately.
On the Murphy motion, all in favor say aye. Oh, I'm sorry. Senator Johnson.
Thank you, Mr. Chair. Mr. President, we're going to go up in caucus in 323, Senate Republicans.
And Mr. President, when we return...
Senator Murphy.
Thank you, Mr. President. When we return, we will take up the Health and Human Services bill.
With that motion, all in favor say aye. Aye. All those opposed say no. The motion prevails. The Senate is now in recess for about 30 minutes, but to the call of the President. The Senate will come to order. Senator Kunis.
Mr. President, I impose a call of the Senate.
The Senate is now under call.
are different sizes, as a matter of fact.
remembered it once you said that.
It's lower than how do you do that?
The sergeant's pick or the people can change it, make it higher or lower. Sergeant, like 4 years.
Oh. Senator Murphy.
Mr. President, I move that further proceedings under the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members.
On that motion, all in favor say aye. All those opposed say no. The motion prevails. Members, I will now call on Senator Wiklund for a motion. Senator Wiklund.
Thank you, Mr. President. I move that the foregoing recommendations and conference committee report on Senate File 4612 be now adopted and that the bill be repassed as amended by the conference committee.
Senator Wiklund, thank you for the motion. Can you tell us what are the differences between when the bill first left us or the changes made in the conference committee? Senator Wiklund.
Thank you, Mr. President. Well, there are some differences to the bill or as it left the Senate floor. Some of the changes were influenced by decisions made within the leadership agreement. This bill, as you remember, has provisions relating to federal compliance with H.R. 1 and SNAP. And in the leadership agreement, the Senate's position, which was providing significant funding for SNAP benefits and SNAP county administration money, that position is now much reduced. The SNAP benefit funding is no longer in the bill, and the admin funding is significantly reduced. We had included in our Senate bill the increases to two of the most critical mental health rates, and those two rate increases are no longer in the bill as well. We had included support for food banks, food shelves, and prepared meals, and that amount has been reduced. We now have $10 million for $5 million for food banks and $5 million for food shelves. In terms of the H.R. 1, the provisions relating to changes due to H.R. 1, the Senate's position that extended the retroactive coverage to be continued at 3 months. That provision is only going to be in effect for 1 year, and then after that it will return to the other federal guidelines, which is 1 month retroactivity for the adult population and 2 months for families and children. We had delayed the cost-sharing provision in the Senate bill, and that position is no longer in the bill, and it will not be delayed. We have other items that change. This bill does contain significant funding for hospital stabilization, and I'll go through that article. The hospital stabilization is in Article 3 of the bill. As we had in the Senate position, we still have a hospital stabilization program for other hospitals besides HCMC, and it does have a payment program for HCMC. But there are some changes to the way the language or the provisions are structured. So in Article 3, there is the addition of a hospital stabilization reserve, and that is a reserve account that is going to be set up in the general fund, and there will be $500 million that will be placed into that fund, and that will be something that Hennepin County Medical Center will be able to draw on over a period of years until June 30th, 2031. And so Hennepin Healthcare will be able to submit a request for payment out of that account, and then using the Commissioner of Health review and the LAC process, they will be able to assess and validate the requests, and then if they are certified, then they will make a payment to Hennepin Healthcare. There is also language in this bill that has to do with governance of Hennepin Healthcare. There are modifications that modify the governance of the board of the Hennepin Healthcare. It lays out specific criteria for Hennepin Healthcare board members, what types of backgrounds they need to have. At least 75% of the board's non-county commissioner members must have expertise in hospital administration, finance, business management, law, or health equity, or have other experience relevant. Up to 25% of the board's non-county commissioner members may represent urban, cultural, and ethnic perspectives of the population served by the corporation. There is a clause that county commissioner members are not eligible to serve as officers of the corporate board. In the area of financial oversight, there's more language related to how the corporate board or how the county board provides oversight of the finances of Hennepin Healthcare, and also provides different criteria or modified criteria for the county board to be able to exercise their right to dissolve the corporate board and reorganize. So those are changes that were discussed with a group from the House and the Senate on governance language. Then there is, as I mentioned, a hospital stabilization program. The Senate position, we had over $100 million in that, but now in this bill, there is $30 million in this hospital stabilization fund, and the qualifying hospitals are ones that are, excuse me, and now I'm losing my place. Sorry. The qualifying hospitals are disproportionate share, Medicaid disproportionate share hospitals, and also there is a flat payment of $50,000 to critical access hospitals out of this fund of $30 million. And there's an application process that is related to calculations of uncompensated care amounts, and that work will go on with the Department of Health to administer those grants. Then there is a section that has to do with the Hennepin healthcare payments, and that includes criteria for accountability. There's accountability requirements for Hennepin to submit to the Department of Health, and they will be used to scrutinize and assess how Hennepin Healthcare is trying to stabilize their financial situation. That includes quarterly updates of financial information, comprehensive financial analysis, and then there will be a reporting requirement that the Commissioner of Health will report to the committees with jurisdiction over Health and Human Services, Finance and Policy. And lastly, in that section, there's an advisory task force that is, we had a similar task force in the Senate position. This has been modified to a certain extent, but still is the same principles of developing recommendations to the legislature on the ownership, governance, and financing of Hennepin Healthcare system. And then there are specific duties for this task force, and membership is laid out. It is laid out so that the governor can make these direct appointments soon after session ends so that this governance task force can get going right away. So those are the provisions that relate to Hennepin Healthcare. I don't think I mentioned that our bill that left the floor had $150 million for direct payments to Hennepin, and now that is increased to $205 million. Let's see, next, as far as changes, there are some additional items that have been added to the bill that were not in the Senate position. The bill that relates to medical assistance fraud prevention, that language and funding is now included in this bill. There are also some miscellaneous provisions that, one that relates to PFAS, and one that relates to the EGIP study that relates to health insurance for for educators and school districts. There's a study that had passed, had been heard in other committees, and that is included, and that is in the Article 14, the miscellaneous article. And let's see, oh, and another change is that there is a rate increase for critical access hospitals. It's a 30% increase, and that will take effect in the next year. Another thing that we did have in the Senate position but is no longer in the bill, we had a coverage mandate for IVF, and that was not accepted by the House and is not included in this bill. We also had a provision for mental health providers and insurance plans, and any willing provider provision, and that was not accepted by the House either. The articles that relate to gas resource development are in the bill, is still in the bill, as well as the child care licensing for child care centers and for family child care. And I would say those are the key changes. I'm happy to discuss or talk about any of the other aspects of the bill if people have questions or comments, and I'm open to questions. Thank you. Mr. President, I'd like to request a roll call, please.
Roll call requested, roll call granted. Senator Miller.
Thank you, Mr. President. Senator Wiklund, I had communicated with you a little bit in the last day or so about rural PPS, or prospective payment system hospitals. To be perfect, I mean, I tried to read through this. It was 330 pages. I don't believe that there was a public hearing on the bill, so I'm trying to get through the pages of the bill, and it is still unclear to me, Senator Wiklund, whether or not these rural PPS hospitals would be eligible for this hospital stabilization fund. So I'm wondering if Senator Wiklund would yield for a question.
Senator Wiklund, will you yield? Senator Wiklund will yield.
Mr. President, my first question is, Senator Wiklund, was there a public hearing on the conference committee report for this bill?
Senator Wiklund.
I'm sorry, Mr. President. Could you repeat the question, Senator Miller?
Senator Miller.
Yes, thank you, Mr. President. Senator Wiklund, was there a public hearing on the conference committee report?
Senator Wiklund.
Mr. President, Senator, no, there was not.
Senator Miller.
Thank you, Mr. President. I'm wondering if Senator Wiklund would yield for another question.
Senator Wiklund will yield. Senator Miller.
Thank you, Mr. President. Senator Wiklund, I'm not sure if you heard me when I said it a little bit earlier. It was a little loud in the chamber, but you and me have had some conversations over the last day or so about these rural PPS hospitals, or prospective payment system hospitals. I'm wondering, it's unclear to me, I did not get a chance to read through all 330 pages of the conference committee report, so it's unclear to me whether or not they are eligible. So my question for Senator Wiklund is, are the rural PPS hospitals in Minnesota eligible for the Hospital Stabilization Fund dollars?
Senator Wiklund.
Mr. President, Senator Miller, no, that category of hospital is not included. When we originally had this stabilization grant program in the bill when it left the Senate floor, we had funded it at a level of about $114 million. After the leadership agreement was presented, the stabilization pool is now $30 million, and so we had to do some reconsideration of which hospital types would be included. We determined that we would focus on the Medicaid disproportionate share hospitals. These are the hospitals that are most likely to be impacted immediately after the impacts of HR1 are being felt by hospitals. And so we included disproportionate share hospitals, Medicaid disproportionate share hospitals, and then there is also a provision for critical access hospitals to receive a one-time payment of $50,000 to each of those hospitals and the rural emergency hospital that exist in the state.
Senator Miller.
Thank you, Mr. President. Thank you, Senator Wiklund. Well, for me, members, that's very disappointing. It feels like we're picking winners and losers. And rural PPS hospitals are acute care hospitals where Medicare pays the hospital a fixed, predetermined amount for each patient or service rather than reimbursing them for the hospital's actual costs. So what does that mean? That means that the members in this chamber that represent small rural hospitals who in many cases are struggling financially because they're not getting fully reimbursed for Medicare or Medicaid patients, they are not eligible for this stabilization fund where other hospitals in the state of Minnesota are. So there are several rural health systems across the state that were not chosen to be eligible for this grant funding, but then there are other hospitals that probably need the funding as well, but they were chosen, and now they are eligible. And we didn't have to do that, members. And if there would have been a public hearing on this, and if I would have had an opportunity to read through these 330 pages, I would have maybe had a little bit better understanding, and I would have tried to get at this a little bit earlier. But it's very disappointing that some of our rural hospitals are being left out, and in this case, they're being picked as the losers, while other hospitals are being picked as the winners.
Senator Uckey.
Thank you, Mr. President. And I've got a couple questions that I've just quickly run across in the bill, so if Senator Wiklund would yield.
Senator Wiklund, will you yield? She will yield. Senator Uckey.
Thank you, Mr. President. Senator Wiklund, and I'm only into about page 50 of the bill, and I come across some things that caught my eye. When you get to multimodal systems, it talks about aeronautics, airport development, and assistance, and I do read through. We got a number of pieces here: aviation supports, civil air patrol, and then we get to the passenger rail. Then I do find some new language. Can you explain what's going on there?
Senator Wiklund, were you asking her to yield? Yep. Senator Wiklund, to the question.
Thank you, Mr. President. On page 54, Senator Utke, this all this language, it relates to a cancellation, and that cancellation is going to this hospital stabilization reserve account.
Senator Urke.
Thank you, Mr. President. Thank you, Senator Wiklund. And it appears 5.6 million or something. If Senator Wiklund could just confirm if she would yield, am I reading that right? We're looking at about $5.5 million possibly.
Senator Wiklund, will you yield? She will yield. Senator Wiklund to the question.
Mr. President, Senator Udke, I'm not sure. I mean, the cancellations are a little bit challenging to read, but it is putting money from some projects, I assume, that are not utilizing the funding, and it's putting it in that hospital stabilization reserve account, which is what the Hennepin County Hennepin Healthcare will be able to apply to draw on if they need that for financial stabilization.
Senator Urke.
Thank you, Mr. President, and thank you, Senator Wiklund. That's all for right now. I just got to check out a few more things, so thank you.
Any other discussions on this section? Senator Coran, we are on adopting the committee report. Senator Coran.
Thank you, Mr. President. And would Senator Wiklund yield for a question?
Senator Wiklund, will you yield? She will yield. Senator Coran.
Thank you, Mr. President. Senator Wiklund, it appears that we had worked together in the formulation of the task force, the advisory task force, to include an EMS member for Hennepin County, as it's vital to making sure everyone's represented. Could you help us understand how or why that was pulled out?
Senator Wiklund to the question.
Mr. President, Senator Cran, the task force was kind of restructured. The makeup of it was restructured from designating individual members, from certain organizations. It now has a membership that's listed on page 62. Those are the individuals that will be on the task force, and they have experience in different areas. And then under the duties section, you'll see that there is a specific duty that they need to engage with public health leaders throughout the state, number 7 on page 63, and duty to engage with public health leaders throughout the state and professionals and individuals with the following qualifications or with expertise in the following areas. And one of those is Roman numeral 6, ambulance service providers or emergency medical services. It was felt that by doing it this way, we would have people with focused expertise, but then also have them be able to go out and collaborate with and draw in information from many different stakeholder groups, because there were a large number of stakeholder groups that wished to participate.
Senator Coran.
Mr. President, thank you, Senator Wiklund. I still have concerns that EMS is one of the critical aspects and core components, and to have them be included that, or they should be in the conversation, that's one thing. Having them be directly involved in all the conversations, especially with the greatest challenges that HCMC has in the areas where we need the greatest work, and that is one of them, in the front lines. So I'm disappointed to hear that we've changed that and that it was removed specifically. We'll continue to work on it. Thank you.
Senator Gruenhagen.
Well, thank you, Mr. President. Yeah, I'm looking through this bill too. Just if Senator Wiklund would yield.
Senator Wiklund, will you yield? She will yield, Senator Gruenhagen.
Okay, thank you, Mr. President. Thank you, Senator Wiklund. See, I think it's on page 60, 61, about the Hennepin healthcare system. I think it's like the first payment is I can't see it in here, but I think the first payment is like 200 million this year. Is that correct?
Senator Gruenhagen, excuse me, Senator Wiklund.
Mr. President, Senator Gruenhagen, the way that the payments are structured, there will be a $50 million payment that would be in fiscal year 26 that's will go out as soon as possible, and I believe that it states in the appropriations rider that it's to be delivered by July 1st. And then for the next fiscal year, there's another $55 million roughly payment. And then outside of that, there's also $100 million that is being directed through the DHS Directed Payment Program. So that altogether, it's $205 million.
Senator Gruenhagen.
Oh, well, thank you for that response, Senator Wiklund. Say, my understanding that money is coming from our rainy day fund, is that correct? Or where does that money come out of?
Senator
If she would yield.
you asking her to yield. Senator
Yeah.
Wiklund, will you yield? She will yield. Senator Wiklund.
No, those payment, well, no, they are not coming from the reserve.
Senator Gruenhagen.
Mr. President, Senator Wiklund would yield?
Senator Wiklund, will you yield? She will yield. Senator Gruenhagen.
Where is the money coming out of? Is it from the general fund or where?
Senator Wiklund, to the question.
Mr. President, Senator Gruenhagen, yes, the general fund.
Senator Gruenhagen.
Okay, thank you, Senator Wiklund. The other thing, there was an article in the with the Center for the American Experiment. I don't know if you had a chance to look at it, Senator Wiklund, but it showed that Hennepin Healthcare spent over $50 million on diversity education, DEI, and the result is it really had nothing to do with healthcare. Is there anything in this bill to require them to spend the money on healthcare that we're giving them from taxpayers rather than wasting it on DEI programs? If Senator Wiklund would yield.
Senator Wiklund, will you yield? She will yield. Senator Gruenhagen, I think she heard the question. Senator Wiklund.
Mr. President, Senator Gruenhagen, the payment language states that it is to be used in order to stabilize operations, and we want Hennepin Healthcare and Hennepin County Medical Center to remain the statewide asset that it is today and keep providing the unique services that are utilized by residents all across Minnesota. And that is what the goal is, stability, or helping them to become financially stable and continue to be able to provide those critical services.
Senator Gruenhagen.
Oh, well, thank you, Senator Wiklund. Yeah, members, we really need, if they're using taxpayer money, the last thing they should be doing, they should emphasize it on operations, like Senator Wiklund said, and not use it for promoting a political agenda such as DEI, which really had nothing to do with health care. So I hope that this bill will reinforce that perspective so we can stop wasting money at the Hennepin Healthcare, which I agree is an asset and a teaching hospital, and it is something we want to maintain for our healthcare in the state of Minnesota. It's a trauma center also. So if Senator Wiklund would yield, I have one more question.
Senator Wiklund, will you yield? She will yield. Senator Gruenhagen.
Okay, on page 179, there's a child care licensing modernization provisions. And my understanding is that during HHS, there was a lot of testimony by daycare and child care individuals, especially the smaller ones, about concerns in there that this would put them out of business. Has that been addressed, or what was their main concern out of the smaller daycare people out of this? Because, you know, in my district, I'm losing small daycare people. They're just throwing their hands up and saying, I'm not doing this anymore. And it almost seems like we're social engineering the smaller daycare people out of business and trying to push the children into larger daycare settings. So my question is, again, for Senator Wiklund, what were they concerned about in this bill, and has it been addressed, especially the testimony and concerns raised by smaller daycare providers? If Senator Wiklund would yield.
Senator Wiklund, will you yield? She will yield. Senator Wiklund.
Thank you, Mr. President. Senator Gruenhagen. The two articles that are in the bill, one relates to child care center licensing modernization, and the other relates to family child care licensing modernization. The work has been in progress for about 4 or 5 years now, and through revisions to the drafts that have come out, I believe that the articles that you see in the bill now represent a lot of agreement among providers that this will be helpful. What it does is move our child care regulations from rules and moves it into statute, and it also brings more clarity to it because the rules haven't been adjusted or modified in decades. And so this modernization project, it brings the requirements into more modern language and more, more comfortable for people to understand rather than the 1980s language that was used. I worked with providers for the past several months, and actually even going back last summer, to address specific concerns that were brought forward about provisions in the two articles. And many small changes to the language were made to make them more comfortable. And I believe that at this point we have come up with a solution that most providers will be comfortable with, and understanding that the implementation process with DCYF will be done over a period of months and will not go into effect until at least July of 2027. So I think that many of the really key concerns were addressed over the time the drafts came out. I have addressed more. Senator Curran helped in HHS to bring forward other modifications which were included. So I think that we are in a good position to move this forward this year.
Senator Gruenhagen.
Well, thank you for that response, Senator Wiklund, and hopefully that you addressed many of their concerns. You know, members, especially in the rural area, in my insurance agency, I have a number of smaller daycare providers that were customers of mine, and they've all closed up shop. And when I've talked to them, they said they're just sick of the overregulation by the state. Now, we all want the children to be safe, but I think we're overdoing it and micromanaging every little aspect of a daycare center. The result is we're hassling the neighborhood daycare people right out of business and pushing the children into large daycare centers where they're much more subject, it seems, to abuse, sickness, and a host of other problems. So I'd just be careful. None of us want a daycare situation that is in danger of the children, but the point is that we can overdo it, which government has a habit of doing, and we can bring about more harm than good, and we have a shortage in the rural area and a crisis at this particular point. So thank you, Senator Wiklund, for your response.
Any other discussions before we go to third reading? Are you okay with us going to third reading and then you can speak, Senator Uckey? Is that okay? Is that okay? All right. The secretary will give, excuse me, I have to do the adoption first. All those in favor of the adoption? Who? Oh, I'm sorry. I now see there's a roll call. The secretary will take the roll on the adoption of the committee report. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
And Senator Port votes aye.
Senator Port votes aye.
Thank you.
Thank you. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Duckworth votes no.
Senator Duckworth votes no. All members having voted who desires to vote, the Secretary will close the roll. There being 35 ayes and 32 noes, the committee report is adopted. The Secretary will give it its third reading.
Senate File Number 4612, a bill for an act relating to state government, modifying provisions relating to the Department of Health, gas resource development, hospital stabilization, etc.
Third reading, Senator Uckey.
Thank you, Mr. President. And if Senator Wiklund would yield for another question.
Senator Wiklund, will you yield for another question? She will yield. Senator Uckey.
Thank you, Mr. President. Senator Wiklund, I'll go through the whole thing here, and then we'll let you address it or inform us when I get and I'm starting on page 177, which happens to be the Minnesota African American Family Preservation and Child Welfare Disproportionality Grant Allocations. And it appears that things have changed since we last saw this in print. And when we're looking at the distribution or the breakup or the percentage of how we would distribute the funds, 50% would be distributed on the basis of the child population residing in the county. 25% would be distributed based on a number of screened-in reports on child maltreatment, and then 25% based on the number of open child protection case management cases in a county. And then it gives a minimum amount for a county of $100,000. But if I remember right, previously we were looking at a base amount of $15 million, and the way that one was written originally in the bill was that was to do with the casework, and that the state was going to take and do 100% of the casework for the counties, of which they were going to audit 10% of them, and there was the $15 million and some costs to go along with that. But now it looks like things have changed, and I'm wondering if you could tell us how this is going to work, because what I'm concerned with as I look at that is it makes it look like a lot of that money would stay in the 7-county metro. But I know that out in rural Minnesota, we've got small counties, low populations, but as they calculated what this program was going to cost them, it was still extremely expensive. You know, when they're talking a 10% levy increase on top of their current levies, that's serious money. So if you could just kind of inform us of how this breakdown is going to take place and what our rural counties could expect from this plan. And then the final note is the setting back of the effective date until July 1 of this upcoming year, 2027.
Senator Wiklund, to the question.
Mr. President, Senator Utke, I'll try and answer all those. I'm not sure if I can answer all of those, but the point that you made about Section 11 on page 177, the formula actually is not changing or changed. It's not changed from what left the Senate floor. The amount that the floor amount has gone up to 100,000. It was 75,000. And the language in subdivision 2 does give greater flexibility for counties on how they use it. So this it isn't shifting, more funding for metro versus county or rural areas. It is the same, the formula as it left the Senate. And the effective date, can you restate your question about the effective date?
Senator Utke, she said, can you restate your question about the effective date? Senator Utke.
Yes, thank you, Mr. President. Yeah, when I look at the effective date, page 178, line 18 is where it starts. When we have the exception for subdivision 2, the effective date goes from January 1 to July 1. So we've set it back 6 months. Wondering what we were trying to do there and how that was going to affect the program in this upcoming year.
Senator Wiklund, to the question.
Thank you, Mr. President. Senator Utke, the reason this was changed is that the original language had shifted reviews to 10% of the cases, and the amount of funding that would be needed for that was not allocated in this bill, and so the effective date has been changed by 6 months, moved out to July 1st of 2027, and that was meant to give the legislature another opportunity to look at what the county needs are, another legislative session, to be able to determine whether additional funding would be provided.
Senator Utke.
Thank you, Mr. President. And that just created one little follow-up, if I could, so if Senator Wiklund would yield one more time.
Senator Wiklund, will you yield once more? She will yield once more. Senator Utke.
Thank you, Mr. President. Senator Wiklund, when you talked about with the 6-month delay, and you mentioned the 10%, and that's the casework. The state is still doing the casework for the counties, then correct? It's just that because of funding, et cetera, we just had to push it back before we started to do that. So would the first 6 months, our counties be doing 100% of everything as was originally planned, or what will fall on our counties? Will they start out doing the casework, or will the states be doing the casework from January 1 on?
Senator Wiklund, to the question.
Mr. President, Senator Utke, this language change, it will give the counties more time. They are already collecting the data in SSIS. It gives them more time, and it doesn't add additional responsibilities for them with this change.
Senator Utke.
Thank you, Mr. President. Thank you, Senator Wiklund. That's all I have.
Any other discussion before I go to the bill's author? Senator Abler.
Well, thank you, Mr. President and members. I just want to comment. I hope this doesn't become Senate custom and usage, where we have no public meetings, both this bill or the Human Services Omnibus. I was a con-free on the one, and we had no public meetings, even though from the first time I arrived in a room, I said we should have some. This bill, I'm sure it's got a lot of good things, and I'm really impressed how Senator Wiklund is knowledgeable about all the questions that she's been asked. The timestamp is at 7:59. Mr. President, it's about 9:40, so I picked it up and it was still warm. And so that's nice. But I don't know how anyway the public has any idea what's in here, and I barely do. I leaf through 327 pages, and I have a handful of questions. And so I like a lot of it. I've talked to one of my colleagues in the House, the other body, about some of the things in here. But in 327 pages, there could be a lot. So anyway, Senator Wiklund would yield for a series of questions.
Senator Wiklund, will you yield? She will yield. Senator Abler.
Thank you, Senator Wiklund. On page 23, lines 23 to 25, it talks about exception to consent. The Health Data Institute is given some special treatment. Can you tell me what that is? I don't even know what this relates to. Can you just tell me what information is going to be more available than it was before, please?
Senator Wiklund.
Mr. President, Senator Abler, this is from a Department of Health policy bill, and this entity just no longer exists, and so this language is just helping to make sure that that is not left in statute.
Okay, well, thank you.
Senator Abler.
That seems like a great idea, so I'm happy to know that. And so it looks like the LAC will be distributing the funding. They've had a habit of doing that in the past. Mr. President and members, one of the weaknesses of the LAC passing out this money is it's a bipartisan group, but it could be structured as a partisan group depending upon who's in charge. And Senator Wiklund, I guess you're not going to be here, but I think it would make more sense to have a group that's not subject to some partisan influence deciding who gets this very special money. I don't think this has to be a partisan thing, and so if there's a way to make that work better, I would recommend that. If she'll yield again.
Senator Wiklund, will you yield? She will yield. Senator Abler.
Thanks. On line 59.25, it talks about this board. And the corporate board of whatever directors for the Hennepin healthcare system, which seems like a good idea. Could you tell me who's on that board, please?
Senator Wiklund, to the question.
Thank you, Mr. President. Yes, Senator Abler, I skipped over that section when I was giving the overview of that article. The corporate board of Hennepin Healthcare System is the existing board of directors, basically, for the hospital. So right now, the corporate board is made up of the Hennepin County Commissioners because they took the step last year to dissolve the existing corporate board, and so the Hennepin County Commissioners are also the Hennepin Healthcare Corporate Board. What this section does is it gives direction to indicate to Hennepin Healthcare and to Hennepin County that they need to move away from the Hennepin County Board of Commissioners acting as the corporate board. And so it directs them by January 15th, 2027 to reconstitute the corporate board with members who meet the requirements that are in statute. In the governance area of the statute that I mentioned, some changes, that's where it indicates who qualifies to be a member of that board.
Thank you.
That's all this section is doing.
Mr. President, just one more question. I've been told we need to move along, and I respect that, but I really am feeling burdened. We got a 327-page, really important bill that spends a couple $100 million creating all kinds of things. But just one more question, and it wasn't me who planned this schedule, Mr. President. Just one more question, Senator Wiklund, if you'll yield. She will yield. If she'll yield, Mr. President.
Senator Wiklund, will you yield? She will yield. Senator Abler.
Thank you, Senator Wiklund. In the committee, we put 3 people from labor on this board. I noticed on page 63 they're going to be consulting. Are they happy about that, or is this just something that came up in a room as well that you thought that whoever was working on this thought made sense?
Senator Wiklund, to the question.
Mr. President, Senator Abler, as I mentioned when Senator Curran asked the question about EMS being on the board, we had discussions with some House members who had also been working on kind of how should a task force be formed. The governor has Jan Malcolm appointed to do some work to understand, how we should be looking at the healthcare system, and Hennepin County Medical Center as well. And so through those discussions, we determined that the advisory task force should be something that's fairly small and not have so many designated positions, because it was really challenging to find a way to include every group entity that wanted to be a designated member. And so now one of the duties, as I mentioned, is number 7, and that's to engage with. And it lists out, so not only registered nurses, organized labor, ambulance service providers, physicians. It's meant to encompass all of the different labor aspects. And we can have different opinion about what form of a task force is more effective, but based on discussions, we determined that we thought this would be a way to get at recommendations and still involve all these different types of professional groups.
Thank you, Mr.
Senator
President. And I'm trying not to go long. Well, I guess I would disagree with you. I think given how tough it is to work with the contractual needs of AFSCME, MNA, and SEIU, and some of the others, I think keeping them close and helping be part of the decisions would actually help the buy-in and would actually bring more of a solidarity comity to the group. So, Senator Wiklund, I'm trying to trust in the work that was done by whoever was working on this, and I expect I'll be voting yes, but I just hope there aren't any surprises. But Mr. President, you're the president of this place. We have devolved into a place where conference committees don't meet, where we have a limited number of people, and the ones we did, I'll talk about that maybe, but only 2 of us could be in there because there were 3 or 4 House members, and it's totally unfair. We're not being represented correctly in a bipartisan, bicameral way, and it is not the right way to do business. And this is another one of these. So thank you, Mr. President.
All right, here are the folks that are on my list. I want to make sure that I have the right people. Senator Clark, were you want to say anything? Okay. Senator Dibble, were you on that list too? Senator Dibble. And I also know that Senator Liskey's on the list, and Senator Hawj.
Thank you, Mr. President. Mr. President, I just wanted to take a moment to thank Senator Wiklund for the incredibly hard work she has done on behalf of Hennepin County Medical Center, also known as Hennepin Healthcare. This is truly an indispensable public institution. It is a state and a regional asset with statewide and even multi-state regional importance. Members, it's been stated before, but I think it's just worth reflecting for just a moment on what exactly this institution provides for everyone in this state. The amount of care provides that takes pressure off of both our metro area hospitals and certainly our regional smaller hospitals that are in greater Minnesota around the state. We already know, of course, it's an extremely important level 1 trauma care hospital. It's a safety net hospital for Minnesota. It receives many, many patients that bypass other hospitals, many who come in the door without any ability to pay the proverbial uncompensated care. It is a preeminent EMS and pre-hospital care, providing tremendous leadership for those paramedic and EMS services. It's an emergency and disaster response hub, coordinating those wide-scale community disasters. It provides a regional burn treatment center with some of the finest burn care in the upper Midwest and in the country. It has a very, very important and extremely special and rare hyperbaric medicine and advanced wound care chamber. Has an extremely vital and important poison treatment and medical toxicology center, again, providing statewide reach to people who need that kind of important care. And if they can't get here in time, they provide critical support for those who are being treated at hospitals around the country, around the state. It is a statewide referral center. It has specialized medical centers, has centers to care for highly complex patients. It is a major teaching and training hospital. I think a third of the doctors in our state go through their residency at HCMC. Many of the professionals in the allied health trades and professions also receive their training, and there's important research and innovation that emanates out from HCMC. They provide crucial behavioral health and psychiatric services. They have very innovative access programs for underserved populations, setting the standard, again, providing research and innovation in the realm of public health. And of course, they represent an extremely important economic and workforce impact. What we're doing today to stabilize and secure this institution for the future.
Senator Dibble, will you look this way, please?
Moving on to future opportunities for what this institution needs by way of its capital realm, its capital assets. The hospital itself at some point needs to be transformed. That might happen in partnership with the University of Minnesota. It might happen in a whole variety of ways. The task force is going to take a look at that and bring back some recommendations to this legislature. But what we're doing today is of vital importance to the constitutional duty we have to take care of people in this state. This is absolutely indispensable, like I said, and the tireless leadership in conjunction with Senator Rest as well, Majority Leader Murphy and others in this chamber. I'm feeling a very deep sense of gratitude. Thank you, Mr. President.
Members, I'm going to the next speaker. I'm just reminding you that we still have some other work to do, so I'm just cautioning us around the time. Senator Liskey.
Thank you, Mr. President. Appreciate the reminder on the time. I'll be brief because I'm good at being brief. There's a couple provisions in here that I am quite nervous about going forward, and the reasons for my no vote today. The child care modernization. We heard groups in support and we heard groups in opposition. I received far more emails from my district saying, please do not support those changes. With that, that would be the reason why I don't support those sections. There was another provision in here that was about medical information, patients' medical information. Now, it's been de-identified, but the problem is there's been lots of research that says they can re-identify it with just a very basic amount of information, and it's not normally an identifying marker that we would decide, but an AI product can actually use that information and re-identify those patients. And now the state is offering to sell it for a fee, and that's concerning to me. Let me talk about the one good thing and what I really appreciate about our committee as a whole. The direct primary care bill that I did get added as an amendment did survive the conference committee report. I would say the conference committee, but as we heard, it wasn't much of a committee hearing. But there was a report. And so I greatly appreciate Senator Wiklund for holding our position of the Senate on that provision, as I believe that the direct primary care provision will drastically reduce the cost of health care in some patients' cases who choose to use cash instead of insurance. So with that, I appreciate everything, and I look forward to the vote. Thank you.
Senator Hawj.
Thank you, Mr. President. I'll be brief, but in this bill is a really important provision for helium rulemaking. We have an exciting prospect on the Iron Range for helium, not only helium, but helium-3. And this is interesting that it's tied to MDH rulemaking because helium is critical for MRI and many medical technologies. So once again, we have an opportunity for Minnesota to lead in resources that are critical to healthcare and future technologies. And I just am grateful to Senator Wiklund for including it in this bill. Thank you, Mr. President.
Any other discussion before we go to the author of the bill? Senator Wiklund, you're our final speaker before final passage.
Thank you, Mr. President. Thank you for the discussion today. There are a lot of great provisions in this bill. It has changed somewhat from when it left the floor, but I think we all recognize that we wanted to come up with a solution to address the needs of Hennepin County Medical Center, and I believe this bill puts forward a solution that not only will help them regain stability, but also adds language that helps us understand how they are being held accountable and reporting to us. Other provisions I'm happy that we included have to do with food support. I wish we could do more, and I wish we would have included more funding for SNAP, and I wish we could have included things like mental health rates. But I think overall, I think we in the Senate carried forward many provisions and retained them in the conference committee work. I'd just like to say thank you to all the staff involved. This bill is really complex and requires a large number of, 3 Senate counsel, a fiscal analyst, and then the similar makeup from the House. These counsel have responsibilities in other committees as well, so the past week has been especially intense for all of us working on this, and I really appreciate all of their dedication to creating this product. I wish we had more time so we could have had a public hearing, but given the constraints we were working under, I feel that the end product is a good one, and also want to thank my staff and all of those in the Senate DFL staff who have helped out with this bill. So thank you, members, for the discussion today. I hope you can support the bill.
The Senate would take, the Secretary would take the roll on final passage of bill, Senate file number 4612. Members, if you'd be so kind as to vote expeditiously because time is getting away from us. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Senator Port votes aye.
Senator Port votes aye.
And Senator Fateh votes aye.
And Senator Fateh votes aye.
Thank you.
Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Duckworth votes no.
Senator Duckworth votes no. All members having voted who desires to vote, the Secretary closed the roll. There being 35 ayes and 32 noes, the bill is passed and the title agreed to. Senator Friends.
Thank you, Mr. President. I move for a recess, about 30 minutes, Mr. President.
On Senator Johnson.
Thank you. Senate Republicans will also be caucusing during this time.
On that motion, all in favor say aye. Aye. All those opposed say no. The motion prevails. The Senate is now in recess for about 30 minutes. Members, the Senate will come to order. Remaining under motions and resolutions, I am going to call on Senator Hoffman for a motion.
Mr. President, I move the foregoing recommendations of the Conference Committee report in Senate File Number 4476 be now adopted. The bill be repassed as amended by the Conference Committee. Thank you, Mr. President.
Members, we're on adoption of the committee report. Senator Hoffman, can you tell us the differences between when the bill left and what happened in the Conference Committee? Senator Hoffman.
Mr. President, I rise today with a heavy heart regarding portions of this Human Services budget agreement. Actually, Mr. President, I'd like to put us under call.
The Senate is now under call.
Nobody's here.
Senator Friends.
Thank you, Mr. President. I move that further proceedings under the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members.
On that motion, all in favor say aye. Aye. All those opposed say no. The motion prevails. I will now return to Senator Hoffman. We are on adoption of the committee report. Senator Hoffman.
Mr. President and members, I rise today with a heavy heart regarding portions of this Human Services budget agreement. Because while this bill contains important protections, while it includes provisions to strengthen integrity in our systems, while it protects nursing homes and addresses critical operational concerns within human services, we cannot ignore the painful truth embedded in this agreement. The so-called leadership agreement between the House and the Senate cuts $300 million from human services over the biennium. It's $300 million, Mr. President, including $150 million in ongoing tails cuts that cap and restrict services to some of Minnesota's most vulnerable citizens. People with disabilities, families already struggling to access care, and individuals who depend upon these services not for convenience, Mr. President, but for survival, dignity, and participation in community life. And as I reflect on this moment, Mr. President, I'm reminded of the words of one of Minnesota's greatest moral leaders, Vice President Hubert Humphrey, who said, "The moral test of government is how that government treats those that are in the dawn of life, the children and those, Mr. President, that are in the twilight of life." Members, let's pause and truly hear these words. The dawn of life, the twilight of life, and the shadows of life. Humphrey was reminding us that budgets are not merely spreadsheets, Mr. President. Budgets are moral documents. Budgets reveal priorities. Budgets expose values. Budgets tell the public who matters and who does not, Mr. President. And today, I struggle deeply with the contradiction between the rhetoric we hear and the actions that were ultimately taken. Because at the very time these massive cuts were imposed on people with disabilities and vulnerable Minnesotans, leadership found resources for other priorities, including, Mr. President, funding tied to studying and rehabilitating a hockey arena and other projects that do not address the immediate well-being of people who rely on these services every single day. Mr. President, that contradiction matters. We cannot proclaim ourselves champions for people with disabilities during press conferences and community events, then quietly hand the Human Services committees in the House and Senate hundreds of millions of dollars in cuts and expect people not to notice. That is not authentic leadership. That is not consistent with the legacy of Hubert Humphrey. And frankly, it's not consistent with the spirit of Paul Wellstone. Wellstone believed government exists to lift people up, not leave them behind, Mr. President. He believed that our politics should have a moral center. He reminded us constantly that we all do better when we all do better. Not some of us, not the politically connected, and not the loudest voices, Mr. President. He meant all of us, including people with disabilities, including seniors, including those with mental health challenges, and including families exhausted from navigating systems that already ask too much of them. And yet, here we are, asked to explain why cuts to vulnerable people became acceptable while other projects somehow remain negotiable, Mr. President. Members, I chair this committee, spent years working on program integrity, have spent years confronting fraud, demanding accountability, strengthening oversight, and protecting taxpayer dollars. This bill continues and contains portions, Mr. President, of that work. There are provisions in here that matter. There are protections for nursing homes and critical services that we can strongly support. But let us not pretend that this agreement arrived without consequences, Mr. President, because there is a cost when we cap services. There is a cost when families lose support. There is a cost when providers are pushed further to the brink. And there is a cost when people with disabilities are told once again to wait. And the greatest cost is the erosion of trust. The public hears us speak about compassion. The public hears us invoke Humphrey and Wellstone. The public hears us say Minnesota cares. But our actions must match those words, Mr. President, because if they do not, then those words become little more than slogans. I say this today, not to inflame division, but because honesty matters in this chamber. It is disingenuous to say one thing and do another. It is inauthentic to celebrate inclusion while reducing the very services that make inclusion possible. And it is wrong to ask vulnerable Minnesotans to absorb the burden of political decisions while more powerful interests continue to find room in this budget. Minnesota has to do better. If we truly believe the legacy of Hubert Humphrey and Paul Wellstone, then we must return to the fundamental principle that government should first protect those who have the least power in this room, not because it's politically convenient, Mr. President, but because it's morally right. Thank you.
Senator Abler.
Thank you, Mr. President, and thank you, Senator Hoffman. That is one of your most eloquent speeches. Mr. President, on a different bill, tonight I had a motion to send it back to conference. It wouldn't do any good, it's getting late. But Mr. President, the error in this bill had to do with the very beginning, with the governor's budget. The governor decided that he wanted to do some worthy things, wonderful things, tax credits for children and buy some other projects around the state. And as part of his budget, he started with a $500 million reduction to this disability arena. The people who are the sickest of the sick, the poorest of the poor, the people with the least ability to accommodate to life without assistance from people who serve. Many of these people who serve, Mr. President, make $20 an hour, and they do it because they love their clients. Now, $500 million sounds like a lot, but Mr. President, Senator Hoffman will tell you that's actually an impact of $1 billion. $1 billion. So we can conduct our state budget activities and all the things we've been voting for, the courts and food shelves and all the things that got spent in Senator Wiklund's bill. HCMC came out of here. Came out of here. Came out of the people with no ability to care for themselves. Some of the people we care for, Mr. President, if they don't have help getting out of bed, Mr. President, they will die. Literally, and we had actually, Senator Hoffman and I know a person who did that. They sent his person away for the weekend. All be good, and he wasn't good. They found him on Monday. And this bill reduces spending by actually over $300 million, which, Senator Hoffman, I have to correct you, the $300 million this bill reduces is actually $600 million on impact in some very focused areas that are where people are trying to create flexibility and opportunities and independence for these individuals. So, Mr. President, there'd be no point to send this bill back, not because the decision was made starting with the governor in February and January, and with the decision of the leadership led by the governor that this is the place to get the money. You know, governors, Mr. President, you know this, that they often get their way on a lot of the ways. And he led the way in this effort, and this is where it catches up, which I think is horrible. And so the committee, I was kind of a part-time member. Again, we're doing things in secret without public meetings. And if this was done in public, you'd have people lined up outside, Mr. President, going, what are you doing? And they've been trying to monitor from home through just little excerpts. But Mr. President, whoever comes back next year, and I pray it's me as well, we have to stop this secret meeting business. We have to. And so to the bill, it was in trouble before it got here. And the decisions made by a group of leaders without my leader, Senator Johnson, as part of the deal, which was ridiculous. You have one seat majority, and now we're acting like it's a trifecta. And what people want, Mr. President, is inclusion. They want quality work. They want us to work together and get things done. And they want us to care for the people who are the most vulnerable. So, Mr. President, I'm just very troubled. Thank you very much.
Senator Liskey.
Thank you, Mr. President. Mr. President, I rise in opposition to this bill, and I'm sure it's no surprise. Every year I've been in the Senate, we've heard reasons to cut funding to something in the Human Services Department. First, we cut care to long-term care, or cut funding to long-term care. Then we cut funding to disability services. Then again last year, if I remember correctly, it was $1.5 billion cut out of the budget. Now we're cutting another $500 million that equates to $1 billion because of federal match. We cut out language that may displace 29 children from their homes. That was in this bill before it left the Senate floor, and here we are coming back with that language stripped out. Why? Because we don't have any money, or at least that's what we keep telling people. Where did the $18 billion go? That's the question, right? That's what a lot of my constituents have asked me. Well, I can tell you it didn't go to disability services. It didn't go to taking care of those that need it the most. And here we are, cutting it again. And so with that, Mr. President, I'll cut my speech short, but I'm very disappointed in this bill, and I urge a no vote.
Senator Lucero.
Thank you, Mr. President. About 6 to 8 weeks ago, I met with a group of nearly 50 family foster care providers. And I just want to say to them, this bill, unfortunately, is the damage that you had thought and feared would come to pass. Ms. Fairchild, I continue to stand with you and the great people across the state of Minnesota that are offering their homes, that are making incredible sacrifices to give the highest quality of life possible to those that are truly in need. I am so amazed at your heart and your devotion and what you continue to offer to these people. And I am so sorry that this is the terrible bill that has come before us that it appears is going to pass into law. And it's going to crush you, your family. It's going to harm those that are in foster care. And it's going to hurt the entire state of Minnesota. Please know that I am strongly opposed to this, but I will continue to fight for what you deserve. This is devastating, and your voice has not gone unheard. And all those that attended that town hall, your voices will not go unheard. We will continue to fight, and I will be opposed to this bill.
Senator Aki.
Thank you, Mr. President. This all started with a horrible governor's budget. That proposal, unimaginable. And what started with that has now led to this. And Senator Hoffman, when you started out by saying you had a heavy heart about this bill, most certainly, and appreciate it. But let's stop it. This bill doesn't need to go forward. The damage it's doing to our disability community, it has no help in there for our foster care providers, our family foster care providers. They've been after us all session with the language that came and actually was put in place while we were in session, but from previous legislation. They were warning us about it, and then it came in to reality, and they've given us data over and over again at how bad this is and how, it's going to displace so many of these people that are receiving care in a family environment. And the state is going to pay a lot more because of that. Plus, we're going to disrupt the place that they live, and they're going to have to move and totally disrupt their lifestyle. So there's so many things in this bill that we don't want. The damage to all of our disability providers, and then with a bill this big, it's still missing the things that would have helped our family care providers. So let's just scrap this one and start over, because we're going backwards. And with that, members, let's send it back.
Senator Friends.
Thank you, Mr. President. I'd like to request a roll call.
Roll call requested, roll call granted. The secretary will take the roll on adopting the committee report. Members, please vote. Senator Westland, are you doing the Rule 40.7 voters? Senator Westland.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. Senator Jasinski.
Thank you, Mr. President. Senator Duckworth votes no.
Senator Duckworth votes no. All senators having voted, who desires to vote, the secretary will close the roll. There being 36 ayes and 29 nays, the conference committee report is adopted. The secretary will give the bill its third reading.
Senate File Number 4476, a bill for an act relating to state government modifying provisions relating to continuity of care, long-term care facilities, health care, etc.
Third reading. Any other discussion? Seeing none, the secretary will take the roll for final passage. Oh, I didn't see you because I looked around. Senator Abler.
Well, thanks. I just thought there'd be a closing comment from the chair as well.
No, because the author was ready to vote.
Oh, okay. Well, that's fine. There are a few things in the bill that are good. I just wanted to comment about some of the good. I just am troubled by the whole direction the thing started. But the nice thing is the nursing homes are going to get $18 million because of this to pay for the back pay when DHS was not able to get the payments in on time. There's, I don't know, I can't think of anything else right now. I didn't make any notes, but it's a really critical area, Mr. President, and I don't know, I didn't have a speech prepared, but I wanted to mention that thing, and so I guess I'm tired, and I left it all on the court, the first speech. Thank you.
Senator Liskey.
Mr. President, I really just want to be brief and say thank you to Senator Hoffman for trying to make this a bipartisan effort. I spent many hours in his office going over this bill and a provision that I tried to get into the bill. So, again, I just wanted to say thank you and appreciate the bipartisanship.
Senator Weissenberg.
Thank you, Mr. President. I will be a no vote on this, but I'm glad that we tried to make this a good amendable bill. Also, if we were passing bills single subjectly throughout the session, we wouldn't be in a hurry to do this at the very end, and we wouldn't be in a hurry to not let people speak. Thank you.
Seeing no further discussions, the Secretary take the roll for final passage as amended. Members, please vote. Senator Westland, those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye.
Thank you.
Senator Jasinski, those voting pursuant to Rule 40.7.
Mr. President, Senator Duckworth votes no.
Senator Duckworth votes no. All senators having voted who desires to vote, the Secretary will close the roll. There being 35 ayes and 31 nays, the bill is passed and its title agreed to. Members, reverting to the, what order? Third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce that the House has adopted the recommendations and report of the Conference Committee on Senate File Number 2077 and repassed said bill in accordance with the report of the committee so adopted. Senate File Number 2077, a bill for an act relating to state government appropriating money for environment and natural resources. Senate File Number 2077 is herewith returned to the Senate. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, no action is required. Members, if you just give us a minute, you can take a deep breath for a couple minutes, and I'll be back with something for us to do. Senator Johnson.
Hey, thank you, Mr. President. Senate Republicans, let's go up in 323 in caucus. We got a couple of bills and a couple of things we want to talk about.
The Senate will come to order. We're going to revert to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce that the House has adopted the recommendation and report of the Conference Committee on House File Number 2438 and repassed said bill in accordance with the report of the committee, so adopted. House File Number 2438, a bill for an act relating to transportation. House File Number 2438 is herewith transmitted to the Senate. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
Members, I'm going to acknowledge and go to Senator Ress, who has a motion. Senator Ress.
Mr. President, I move that the foregoing recommendation and conference committee report on House File 2438 be now adopted and the bill be repassed as amended by the conference committee.
And Senator Ress, will you be so kind to explain the bill or what changes you now see from the conference committee? Please explain those things to the body. Senator Ress.
The changes dealt with federal conformity, putting in the sustainable aviation fuel provisions, sales tax exemption for the PGA, school district, tax aid from Senator Housechild, one-time increase in the homestead credit refund, the minerals tax, the Senate's provisions with regard to tax increment, and the Driscowski's bills on taxing fraud. That's it.
Members, any discussion on the motion to adopt the conference committee report?
Mr. President,
Senator Port.
I request a roll call.
Roll call requested, roll call granted. Seeing none, the Secretary will take the roll for adoption of the committee report. Members, please vote. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Duckworth votes aye.
Senator Duckworth votes aye. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. If you're in the chamber, please vote, or we're going to close the roll. Senator Westland.
Mr. President, Senator Friends votes aye.
Senator Friends votes aye. All members having voted who desires to vote, the Secretary will close the roll. There have been 60 ayes and 7 noes. The conference committee report is adopted. The Secretary will give the bill its third reading.
House File Number 2438, a bill for an act relating to transportation.
Third reading. Any other discussion? Senator Jasinski.
Thank you, Mr. President. Just a quick note, very frustrated. The DVS operating account got swiped $75 million out of their $85 million account. I've been frustrated trying to get money for deputy registers for 8 of my 10 years here. They're stealing $75 million to go to the general fund. We're in the middle of a no-fee transaction for the deputy registers, $2.5 million per year, which expires in 2027. And we want to make sure we have money in that DVS account. So, Mr. President, it's one of the issues. I'm very concerned with taking the $75 million. Thank you, Mr. President.
Senator Weber.
Thank you, Mr. President. I'm going to vote for this bill today, but I just wish to say that this is not a bill that would have come out of the Senate had we had more to say about it. Quite frankly, our local communities have been denied their local sales taxes simply because of the whims of one of the co-chairs over in the House of Representatives, and I think we all know who that one is. It's very frustrating that someone would impose their will against the rights of people to determine their own taxation policy within their community. But with that, Mr. President, I will support the bill and encourage a green vote.
Senator Matthews.
Thank you, Mr. President. Members, I want to thank Senator Rest and the others for working on getting the nuclear study in this bill. It's been something we've been trying to get probably for 4 or 5 years to move this portion forward. I know it's changed from how it was in committee. Different versions came through, but we're happy with where we're at the end of the day, and appreciate all the advocates for working with us to finally get this done.
Senator Westrom?
Mr. President, wondering if the author of the bill would yield for a quick question.
Senator Rest, will you yield? She will not yield. Senator Westrom?
Okay, I can wait, Mr. President. My question I will ask, though, is I would like the author to tell us what did happen to the local sales tax options in this bill. Senator Weber just referenced that, but I'd like to know more detail from the conference committee and why that is not included in this report, which I know Senator Rest, I thought, was quite supportive of. So if she could comment on that in some of her comments, I would sure appreciate it in the interest of brevity.
Senator Westrom, she said she would not yield. I am now going to Senator Pratt.
Thank you, Mr. President. Well, Mr. President, my comments aren't necessarily to this tax deal as much as they are to the overall deal. Members, we are spending $660 million more this biennium than we saw in the February forecast. And net, over this biennium and next biennium, we are going to see a net tax increase of $300 million, and we are spending down what little reserves we had down to about 11 billion. We got good news earlier this year that tax collections were up and we were going to have a small balance. We weren't going to be facing a $2 billion deficit. And the first thing we did was go and spend it and raise taxes. Mr. President, this is an irresponsible deal, and I encourage members to vote no.
Senator Jaskowski.
Thank you, Mr. President. Members, this bill contains the Take It Back Act. We have so far, with the billions of dollars of fraud going on in this state, somewhere in the neighborhood of 25% of the fraud that has been stolen from the taxpayers of Minnesota has been recovered in restitution. This will turn it over to the Minnesota Department of Revenue, turn their auditors loose on the fraudsters of Minnesota, and take our money back and turn it into a tax reduction to the income tax. It's in the bill. I appreciate your support. Thank you, Mr. President.
Any other discussion before we go to the author? Seeing none, the author of the bill. She has no comments. Members, the secretary will take the roll for final passage of the committee report.
Mr. President.
This is House File 2438. Senator Jasinski.
Senator Duckworth votes aye.
Say it one more time.
Senator Duckworth votes aye.
Senator Duckworth votes aye. Senator Westland.
Mr. President, Senator Carlson votes aye.
Senator Carlson votes aye. All members having voted, who desires a vote?
Mr. President.
Mr. President, you want to vote?
Oh. All members having voted, who desires a vote, the secretary will now close the roll. There being 52 ayes and 15 nays, the bill is passed and its title agreed to.
Mr. President.
The secretary will read a resolution.
Senator Boldon introduced Senate Resolution number 97, a Senate resolution expressing the sense of the Senate condemning Commissioner of Commerce Grace Arnold's inaction on enforcement of home care nursing statutes.
Members, this resolution will be referred to the Rules Committee. Now, Senator Pappas, you were trying to get my attention?
Mr. President, in the interest of time, would it be acceptable if I spoke about the bonding bill even though we don't have it in front of us? We're having the spreadsheets passed out. I want to make sure people have time to look at it. And the House still has the Human Services bill to pass before the two bonding bills. I know it's a little unusual, but I'm asking if that might be possible to do.
Let me check Senator Pappas, and if so, I will let you know. Thank you so much. There's some other activities going on, and I want to make sure I don't cause any confusion. Members, the amendment is online, so if you want to go online and see the amendment, we're going to let her talk about it now in the interest of time. Senator Pappas.
Thank you very much, Mr. President. As I said, the spreadsheet, which many of you have seen, is being passed out, as well as the policy provisions. There will be two bills. One will be a bond bill, and that will be House File 719, and then the cash bill will be 2484. So I just wanted to point out some of the high-level highlights from the bonding bill. Oh, first I want to say that last fall, our committee toured for 9 days. We visited 127 projects in 82 cities, and we really learned the important need to address our aging infrastructure and the importance of clean water. So I'm very proud to be presenting this bill today. It includes $145 million for higher ed, $80 million for DNR, including earmarks, $19 million for public safety earmarks, $177 million for transportation, local roads and bridges, and earmarks, $57 million for the Met Council, including metro parks and what we call I&I, inflow and infiltration, $23 million for direct care and treatment, asset preservation, $72 million for veterans, $52 million for the Department of Corrections, $154 million for DEED, that's local earmarks, and $420 million for water and sewer programs and projects. It also contains two provisions from the global agreement, $40 million for Roy Wilkins, and I believe we have passing out a list of all the different events that take place at the Roy Wilkins Auditorium. And then it includes, in the global agreement, the temporary vehicle registration fee reduction. There are minor policy issues that also will be on your desk and modifications from past appropriations. The spreadsheet also includes the second bill, includes both the bond bill and the cash bill. And so you can take a look at that spreadsheet. We had about 28.7 million, and 10 million was part of the global agreement, which would be for design and pre-design for remodeling of the St. Paul River's Edge Arena. During our committee meeting this afternoon, I thanked everyone who was involved in that, and so in the interest of time, I won't go over that list again, but it took a wonderful team of people from my committee, from the House committee, from the GOP. I guess I do want to call out, though, my partner, Karen Housley, Senator Karen Housley, who's not listening to me right now. And thank you so much for your partnership. I really enjoyed working for you. This bill takes a significant step toward addressing the $7 billion in requests that we had through the MMB process. And I'll be very proud in a few minutes, I hope, to present it tonight on our last day of session and on my last day as well. And I hope that other members could make some comments before we actually have the real bill in front of us.
Senator Housley.
Thank you, Mr. President. And I want to thank the members of the Bonding Committee, especially Senator Pappas. In lieu of time, Sandy, I will say a bunch of nice things about you at your retirement party in September, so I hope everybody can come if she invites you. It has been a pleasure to work with you, and I am going to miss you next year and in the years to come doing the bonding bill. I'd also like to thank my staff, Olivia Kloster and Angelique McDonald, for all of the work that you put into this bill. Also, a big thank you to the folks across the state of Minnesota that invited us into their communities. Your concerns were valid. We heard your passion and thoroughly enjoyed your hospitality as we traveled around the state to see your projects. As much as this is a bonding bill, I also think of this as a jobs bill. This bill will create a lot of jobs and work that will need to get done over the next few years across all of our communities. In this bill, we put over $320 million into preserving our state assets, such as our universities, the Minnesota Zoo, our prisons, and our National Sports Center. We also put $150 million into state agencies to help with things like flood hazard mitigation, parks and trails, safe routes to school, early childhood grants, veterans home, and a Duluth hangar for military affairs. We put $162 million into cleaning up our water across the state, both in making our water cleaner to drink and upgrading our wastewater systems and replacing our lead service lines. And for transportation, our roads and bridges, we've got over $66 million ready to get people to work fixing our infrastructure across the state. Then on top of that, we have over $570 million for local projects sprinkled across the state. Almost half of the bill is going directly to our communities for more job-producing projects, wastewater treatment facilities, parks, trails, roads, and bridges. There were many, many more projects that were requested, but we did our best to fund the most needy. I do want to highlight one provision in this bill. Many of you know our Republican Chief of Staff, Jason Fossum, who has served us in that role for the last 2 years. For the past 23 years, he's worked in the legislature. He started in the House in 2003 and came to the Senate a few years later. If you've noticed, Jason hasn't been here for the last week. He hasn't missed a sine die in over 20 years. And a week ago, Jason was diagnosed with brain cancer and has not left the hospital since. Jason was a graduate of Winona State University, and not a day went by that he didn't mention that Winona State was the Harvard of the Midwest. In this bonding bill, we have allocated $1.5 million to Winona State University for them to create a space for students to discuss their political studies. This space will be named the Jason Fossum Legislative Engagement Center in honor of Jason's legacy and his love for the Harvard of the Midwest, Winona State. And to Jason, thank you for your leadership, friendship, and legislative engagement with so many of us over the years. Keep fighting. Thank you.
Senator Jasinski.
Thank you, Mr. Chair. Just want to echo what Senator Housley said about everybody on the bonding committee, both Democrats and Republicans. But I want to give a shout out to Senator Housley, our lead on the bonding committee. She did a phenomenal job. She's done a lot of work, her and her staff. She did just a great job. So thank you, Senator Housley, on our side. And again, thanks to everybody, both Democrats and Republicans. I've been on there 10 years, enjoyed it tremendously. And then also thank you for the $254 million that's going to go back to taxpayers as part of this with the tab fee reduction. Thank you, Mr. President.
Members, we will revert back to the third order of business, and there is a motion, a message first, and the Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted, House File Number 2484, a bill for an act relating to capital investment, appropriating money for library construction grants. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
First reading. Now I will go to Senator Pappas for a motion.
Mr. President, I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File 2484, and that the rules of the Senate be so far suspended as to give House File 2484 its second and third reading and place it on final passage.
Members, on Pappas's motion, Senator Pappas's motion, all in favor say aye. All those opposed say no. The motion prevails. We are now after the adoption of the motion. The Secretary will give the bill its second reading.
House File Number 2484.
Mr. President and members, this is the cash bill that I talked about previously that has small appropriations. You should have those on your desk and should have discussed it in your caucuses. And it includes the $10 billion for the design under the global agreement for the Riverside Arena. I appreciate your support.
Members, I just want to make sure that we're clear with the front desk. We've already done the first reading, and we've done the second reading. We have not done the third reading for final passage. So we're on the we're after the second reading because there's a couple amendments from my understanding. Is that what you understand, Senator Pappas? Are there any amendments?
No.
Okay, since there's no amendments, the Secretary will give the bill its third reading.
House File Number 2484, a bill for an act relating to capital investment appropriating money for library construction grants.
Third reading. Any other discussion on the bill? We've had some discussion already on the bill. Any other discussion before final passage? Seeing none, the Secretary will take the roll for final passage of House File 2484. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Duckworth votes aye.
Senator Duckworth votes aye. If you're at your desk, please vote. All members having voted who desires to vote, the Secretary will close the roll. There have been 50 ayes and 17 nays. The bill is passed and its title agreed to. Give me one moment. You could take a breather for a second before you have to go to the next order of business. Members, we're going to revert to the third order of business. Messages from the House. The Secretary read the message.
Mr. President, I have the honor to announce the passage by the House of the following Senate file as amended by the House, in which amendments the concurrence of the Senate is respectfully requested. Senate file number 5200, a bill for an act relating to legislative enactments, correcting miscellaneous oversights, inconsistencies, etc. Senate file number 5200 is herewith returned to the Senate. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
I'll go to Senator Limmer for a motion.
Thank you, Mr. President. I move that the Senate concur in the amendments by the House to Senate file number 5200 and that the bill be placed on its passage as amended.
And Senator Limmer, to that motion, can you just explain if there were any changes?
Yes, I can, Mr. President. Mr. President, this is my very last piece of legislation. I might just run again. Mr. President, as you know, this is the corrections bill, the vehicle bill for corrections to any bill that's passed both bodies during the 26th session. For a correction to be included in the bill, the proposed correction must be approved by Senator Latz, Representative Liebling, Representative Scott, and myself, as well as the chief authors. The differences are we have included one correction that strikes the remainder of a phrase that was mistakenly recorded, and the second correction is a missing effective date that was placed in the bill. There were only two corrections that I described. So, Mr. President, the bill is before us. I stand for any technical questions.
Members, this is on the motion to concur. All in favor say aye. Aye. Oh, I think Senator Johnson wanted to say something before I said that. Senator Johnson.
Mr. President, being so this is his final piece of legislation, I think we should roll call this so we can get the appropriate sheet so we can all sign it before you get out of here. So, Mr. President, I request a roll call.
And Senator Johnson, we can do that on the roll call because that's the best thing to do, because what we'll do, on the final passage, which will automatically get the roll call. All right, with that being said, without the roll call right now, motion to concur, all in favor say aye. Aye. All those opposed say no. The motion prevails. The Secretary will give the bill its third reading.
Senate file number 5200, a bill for an act relating to legislative enactments, correcting miscellaneous oversights, inconsistencies, ambiguities, etc.
And this is where, on final passage, is a roll call automatically. And now, without any further ado, the Secretary will take the roll on final passage of Senate file number 5200, the last bill for Senator Limmer.
Mr. President.
Senator Jasinski, for those voting pursuant to 40.7.
Senator Duckworth votes no.
Senator Duckworth
no,
votes...
Mr. President, correction. Senator Duckworth votes aye.
Senator Duckworth votes aye. Senator Westland.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. All members having voted who desires to vote, the Secretary will close the roll. There have been 64 ayes and 3 nays. The bill is passed and its title agreed to. Give us a moment. We're just waiting for one more bill. Good to me. All right, here we go. Members, we will revert to the third order of business, messages from the House. The Secretary will read the message.
Mr. President, I have the honor to announce the passage by the House of the following House file herewith transmitted. House File Number 719, a bill for an act relating to capital investment, appropriating money for the Safe Routes to School grant program, authorizing the sale and issuance of state bonds. Signed, Patrick Duffy Murphy, Chief Clerk, House of Representatives.
First reading. Now I'll call on Senator Senator Pappas for a motion. Senator Pappas.
Thank you, Mr. President. I move that an urgency be declared within the meaning of Article 4, Section 19 of the Constitution of Minnesota with respect to House File Number 719, and that the rules of the Senate be so far suspended as to give House File 719 its second and third reading and place it on final passage.
Members, any other words? I'll get you on the third reading. All in favor say aye.
Mr. President, I wanted to do it before.
On the third reading, then is a really good time in order to do that, if that's
I wanted
okay.
to make a point before we declare an urgency.
Okay, Senator Lucero.
Thank you, Mr. President. Years ago, I learned the truth. Failing to plan on your part does not constitute an emergency on my part. And I just have to go on the record and say, this is pathetic what's happening right now. The number of bills and pages and dollars that are being spent and passed without reading bills and just being shuffled along is just pathetic.
On the motion, all in favor say aye. Aye. All those opposed say no. The motion prevails. The Secretary will give the bill its second and third reading.
House File Number 719.
Second reading. The Secretary will give the bill its third reading.
House File Number 719, a bill for an act relating to capital investment, appropriating money for the Safe Routes to School grant program.
Third reading. Any other final comments? Seeing none, the Secretary will take the roll on final passage. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Duckworth votes aye.
Senator Duckworth votes aye. All members having voted who desires to vote, the Secretary will close the roll. There have been 60 ayes and 7 nays. The bill is passed and is titled agreed to. Senator Murphy for a motion to designate a bill.
Thank you, Mr. President. Pursuant to Rule 26, I designate Senate File Number 3967 be made a special order for immediate consideration.
Members, that is the right of the Majority Leader. So the bill that is in front of us, what is that bill number again, Senator? Senate File 3967. Senator Boldon.
Thank you, Mr. President. I move the A2 amendment.
Senator Boldon moves the A2 amendment. The Secretary will report the A2 amendment.
Senator Boldon moves to amend Senate File Number 3967 as follows. Delete everything after the enacting clause and insert. This is the A2 amendment.
Senator Boldon to your A2 amendment.
Thank you, Mr. President. Members, I'm going to be brief because we had a lengthy conversation about this earlier today, which I appreciated. This is related to the home care nursing issue. I appreciated the strong bipartisan support for this body to do something to improve this issue, and this is our chance to do that. The only thing this very simple bill does, it clarifies the original intent of this body, of the legislature, in passing the law related to this in 2010. It just strengthens and clarifies the original intent of that 2010 law. That is the only thing it does. I would ask for your support.
Any discussion? Senator Lucero.
Mr. President, I have no idea what was just explained. I have no idea what we're about to pass.
Senator Lucero,
And Mr. President,
please do
I'm
not
waiting
yell
for
in the mic, please. Please don't yell in the mic. It's okay. State your point, but do not yell in the mic. Senator Lucero.
I assure you, Mr. President, I was not yelling. And if I was yelling, you would know. This is not yelling. Mr. President, this is absolutely pathetic. And you know what? This commentary from the gallery here, telling me that I am yelling, they are out of order and they shouldn't even be in this chamber. So who's ever standing back there, tell them to keep quiet. This is not what we should be doing as a body. I have no idea what Senator Boldon just said. It was said so fast. We didn't caucus this that I'm aware of. And the A2 amendment sounds like it was a DE. And I don't even have it yet. So, Mr. President, just making sure that Minnesotans know how absurd a process that's happening right now.
Any other discussion? Oh, give him the amendment. Is it online yet? It is online. It has been verified that it's online. Any other discussion before we adopt the A2? Seeing none, all in favor of adoption of the A2s?
Oh, Mr. President, I haven't seen the amendment. I don't have my computer out.
We can't do anything about that.
You can't do anything about that? We don't know what it is. So can I have a piece of paper that has the amendment on it? Thank you.
Thank you.
Mr. President, can I read? Mr. President, can I read the amendment so people know what it says?
Will you please?
Thank you.
Members, this is the issue that was talked about earlier with Senator Abler, Senator Rasmussen, all the others who stood and talked about going back to the original language that was missing from in the Commerce bill. And it was discussed that there would be a fix for that language later in the proceedings.
Mr. President,
Senator Boldon.
I would request a roll call.
Roll call requested, roll call granted. Senator Holmstrom.
Thank you, Mr. President. Would the author yield for a question?
She will yield for a question. Senator Holmstrom.
Thank you, Mr. President. I'm trying to understand exactly what this bill is doing. All I see is a legislative purpose statement. Can you please explain exactly, legibly, what this does?
Senator Boldon, to the question.
Mr. President, Senator, that is what it does. As I said, the only thing this does is clarifies the legislative intent for the statute that is already in place.
Thank you.
Senator Holmstrom.
Mr. President, would Senator Liskey yield for a question?
Senator Liskey, will you yield? He will yield. Senator Liskey.
Mr. President, I'm wondering if Senator Liskey believes that this will actually solve the problem that was discussed earlier and brought up by him.
Senator Liskey, to the question.
Thank you, Mr. President. Thank you, Senator Holmstrom. I obviously just trying to read through it in this amount of time. It appears to do exactly as the author of the amendment is intending. It's just reinstating or stating more thoroughly that the enactment in 2010 would maintain the health plans, cover the things that they say they're going to cover. I don't see anything else in here that I would be overly concerned about.
Anything else, Senator Holmstrom?
Thank you, Mr. President. I'm just going to hammer home one last time that this is not how we legislate. This is the last 10 minutes of session. We're bringing forward garbage legislation with zero vetting, zero understanding what this does. I'm very confused.
The Secretary, Senator Wiesenberg.
Thank you, Mr. President. I guess I have a point of parliamentary inquiry. I just heard that there's a senator in the chamber who cannot see and has not been presented with this amendment. Is this ADA compliant when we're passing things when people who are vision impaired do not have the ability to see what they're voting on?
Senator Wiesenberg, the the A2 amendment is placed online as the way it is always, and we believe that it meets the qualifications of ADA. Senator, was it Dames?
Yes, and thank you, Mr. Chair and members. And I do have a concern on this amendment. And that concern is that I realize we want to go back to the 2010 era and how this was laid out. But when this was approved, when the rating structure and stuff was approved by the Department of Commerce, the insurance companies were not rating this as to be going back to what was happening in 2010. So I'm concerned we're passing an amendment here that's going to have a major effect on the rates, and those major affected rates are going to be on the individual market. And so I'm very concerned about just going ahead with this without having the information, without giving the insurance companies an opportunity to come up with the proper rate structure and find out where this is really going to be. I think this is something that we really need to take a look at. Thank you, Mr. President.
Any other discussion? The Secretary will take the roll for the A2 amendment. Senator Westland, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Carlson votes aye.
Senator Carlson votes aye. Senator Jasinski, for those voting pursuant to Rule 40.7.
Thank you, Mr. President. Senator Duckworth votes aye.
Senator Duckworth votes aye. All members having voted who desires to vote, the Secretary will close the roll. There being 45 ayes and 22 nays, the A2 amendment is adopted. Members, the Secretary will give the bill its third reading.
Senate File Number 3967, a bill for an act relating to human services modifying the due date of the pediatric hospital home to transition pilot program.
Third reading. Any other discussion? Senator Holmstrom.
Mr. President, is there time to pass this yet in the House?
Yes.
I'll sit down.
The Secretary will take the roll on final passage as amended. To Senate File Number 3967.
Mr. President.
Senator Westland, for those voting pursuant to Rule 40.7.
Senator Carlson votes aye.
Senator Carlson votes aye. Senator Jasinski.
Thank you, Mr. President. Senator Duckworth votes aye.
Senator Duckworth votes aye. All members having voted who desires to vote, the Secretary will close the roll. There have been 40 ayes and 27 nays. The bill is passed and its title agreed to.
Mr. President.
Senator Murphy.
Thank you, Mr. President. Pursuant to Rule 26, I designate Senate File 3908 be made a special order for immediate consideration. This is a Dibble transportation bill.
Members, the designation has been made. We are now on Senate File Number 3908.
House file.
It's a House file. House Files 3508. Senator Dibble.
Thank you, Mr. President. I would offer the A1 amendment to House File 3908.
Senator Dibble offers the A1 amendment. The Secretary will report the A1 amendment.
We don't have it at the desk.
We do not have it. Members, just for your clarity, it's 11:54. No business can be conducted after midnight. No bills can be passed, but business can continue. But no bills can be passed.
Do we have it in form where we can post it? We're unable to post it. We're unable to post it in this form. We're going to have to wait.
Members, we're going to have to wait and make paper copies.
Mr. President?
Senator Westrom.
Mr. President.
In the interest of time, I was wondering if the author would yield while we're waiting.
Will you yield? He will yield. Senator Westrom.
Mr. President, Senator Dibble, just wondering, in the proposed amendment that we're waiting for, is there going to be anything to help advance the autonomous vehicles that we've talked about this year and had demonstrations here at the Capitol as we try to embrace that new intriguing technology?
Senator Dibble to the question.
Thank you for the question, Senator Westrom. Unfortunately, there will not be.
Members, we're still waiting. Senator Dibble, you can talk about the amendment.
Thank you, Mr. President. Members, you have at your desk a handout that was signed by myself and Senator Jasinski. Just a number of policy issues that we dealt with in the Transportation Committee.
Senator Dibble, I just want to announce that it's now online. Senator Dibble, continue, please.
Thank you. Very quickly, it has just a number of items you can see on the piece of paper in front of you: cost participation, bridge inspection, tunnel inspections, title transfers, et cetera. Thank you, Mr. President.
Mr.
Mr.
President.
Hold on. If you give me one moment, please.
Hold on. It's out. We can report it.
The A1 has been released. We're going to let the Secretary report the A1.
Senator Dibble moves to amend House File Number 3908 as follows. Page 3, line 1. The amendment is coded SCH 3908A-1.
Members, Senator Dibble, anything else to your A1, or can we go to questions really quick? Okay. Senator Lucero.
Thank you,
we're
Mr.
on the A1 amendment.
Thank you, Mr. President. Would Senator Dibble yield for a question?
Senator Dibble, will you yield? He will yield. Senator Lucero.
Thank you, Mr. President. And Senator Dibble, I didn't hear anything about what is in this amendment. Is it a DE amendment? Is it a line and page amendment? What is it, and what are the contents?
Senator Dibble to the question.
Thank you, Mr. President. The amendment is posted online, Senator Lucero. It is a delete everything amendment with a compilation of some non-controversial Transportation Committee policy items.
Senator Jasinski.
Mr. President, I'm not done.
You're right. You still has the floor. I'm sorry. Senator Lucero.
Okay, thank you, Mr. President. Thank you, Senator Dibble, for telling me it's online, and there's literally 90 seconds left. I don't have time to fire up my laptop and log in and read it. I don't even know how many pages. My question, Mr. President and Senator Dibble, is how many pages is this?
Mr. President, I withdraw
Why is he speaking? I didn't ask him to yield.
Mr. President, I withdraw the amendment.
Why is he speaking? I have the floor, Mr. President.
Senator Dibble, you do have to let him continue with the floor. He's attempting to withdraw the amendment. So would you like for him to withdraw it, or would you like to continue to talk? Senator Lucero.
I would like to continue to talk. So the first thing I want is a copy of this amendment. Thank you.
Senator
the first
Dibble.
thing that I can see here is that it is 21 pages long, members. 21 pages, and I look at the top. It is a DE. So it's a delete everything. So it's House File 3908, and it's a DE, attempting to replace with 21 pages, and we have 60 seconds to read it. And so, no, I don't think that this is in order, and this is not the way we should be conducting business at all. And as I look here, on page 1, it says, well, I guess point made, Mr. President.
Mr. President.
Senator Dibble.
I'd like to withdraw the A1 and...
The A1 is withdrawn. Senator Dibble.
Table the bill. And can we table the bill, Mr. President?
The motion is to lay the bill on the table. All in favor say aye. All those opposed say no. The motion prevails. The bill is laid on the table. Senator Murphy.
Mr. President.
Senator Murphy.
Thank you, Mr. President and members. Mr. President, I move that the Secretary of the Senate notify the Governor and the House of Representatives that the Senate is about to adjourn the 2026 session sine die.
On that motion for the notice, all in favor say aye. Aye. All those opposed say no. The motion prevails. Senator Murphy.
Thank you, Mr. President. I move the Senate do now adjourn sine die.
No discussion. On that motion, all in favor say aye. All those opposed say no. The motion prevails. The Senate adjourns, sine die. Members, just so that you remember that our last day is tomorrow, the 18th, where there will be retirement speeches. And if someone can clarify the time, that would be helpful.
Thank you, Mr. President. We will come back together tomorrow at noon.
Members, we'll see you tomorrow at noon. The Senate is now adjourned.